Hello and welcome to Seven Sentinels. This is Grand Master Class and I am Peter Simon with you. So, take your notebooks and get ready. Today's lecture is all about reading part A. Reading part A. The use of feeding tubes in pediatrics. Feeding tubes. The use of feeding tubes in pediatrics. Fine. Okay. Now here, we are going to learn some new techniques. We are going to learn some new techniques. Now, what are these techniques? And are these useful for every reading part A? Not just right. It is 10 times right. If this is what your question is, Mr. Simon is teaching reading part A techniques and strategies. How far are these useful? How far are these beneficial? Can we use them in every reading part A? If that is your question, definitely you have asked a very valuable question to yourself. Because whenever you do something, you ask a question. Because we have to be reasonable. That means we have a reason to do something else. Anything in that matter. Without a reason, we are not going to do anything. For example, you are preparing for the OET. You have a reason. Now, what is this reason? Reason is the purpose, the goal, the ambition, the objective, the cause, the driving force, the binding cause. Because you want to clear OET. Why do you want to clear OET? Because if you want to work abroad, you need to clear OET and you have to submit a proof of that. That is called the reason for why you are doing the OET. That's okay. Definitely not okay. If you want to clear the OET, you will try to clear the OET. You will prepare in such a level that you can only clear OET. And if something goes wrong and somewhere it hits hard, you're lost. You're doomed. You are in tears. You are at the verge of tears. No, you're already drowned in tears because you lost the battle. And what is the reason that you lost the battle? For what? It is you, yourself. Today we got some results, mixed results it was. Mixed results. 2 students went for exam. This particular result today. One is Dr. Aisha Murtada from the United Kingdom. She is actually from Nigeria. She is actually from Nigeria. I want to share, yes, Aisha Murtada. She is now in the United Kingdom. These are her contact details. SS7 Sentinels candidate Aisha Murtada, United Kingdom, Nigeria, medicine, prepared for OET, and this is her contact number. Okay, fine, we don't want all those things now. Let me show you here. She called me personally and she asked me, sir, today I got my result. Today I got my result. Yes. And then I was perplexed. She just said, I got my result. I was stupefied. I was, I did not know what to talk. Anybody will call and say, I have passed or I have lost. But this girl said, I got my results in a normal flat tone. No happiness, no sorrow, and I was in the middle of something and I could not guess what it was she was up to. Then I asked her, what is the result? And she said, you guess, sir, what happened? No surprise. It was, blasting shock. It was an earthquake which jolted me. How can I guess? I said, I cannot guess how you did in the exam. But according to what you have done, the tests with me and the practice with me, I'm sure you'll definitely clear your exam. I don't know whether you'll get 400 plus, but you will definitely clear because you were just 10 to 12 days with me. No, sir, it was just 10 days and it was a crash course. I paid you, you said 10,000 and you gave me a discount of 2,000 and I paid 8,000. Yes, that is what I take for doctors. For crash course, 10,000, 10 days or 1 week for doctors. So, no, sir, you guess. I'm sorry, I cannot guess, but according to my guess, it may be in between 350 to 400, but definitely not above 400. I cannot expect that much. How correctly you have guessed, sir. You're right. The least marks were 350 and the highest marks were 400. The highest marks were for speaking, that is 400, and the least marks for writing, 350. Then I asked her, are you happy? It was an interview. I play it for you now. I will play it for you now. And I asked her, are you happy? Yes, sir. This is the first time I went for the exam. I did not know what to do. Last minute, I somehow got added to your Telegram channel and I got in touch with you. I did not know whether it was you or somebody else because many people will be posting. I said, all I'm operating those numbers, nobody else. Sir, if I had not joined you, maybe I would have lost in writing because I got 350 only. After all this training for 10 days, after your feedback and everything, I would not want to risk that, sir. Okay, fine. So, and then reading 380 and listening 360. Her headphones broke, it seems, or something like that. She was telling some problem. Not headphones, sorry, pencil broke. Pencil point broke. I think that's what she told. And I could not do something last minute, something I missed, she told. Otherwise, I would have scored here also. So the same scores as if in the reading. I said, okay, right? I'm going to make you hear that testimony. You should know, because a doctor's testimony is important. In that case, nurse's testimony is also important. Podiatrists or physiotherapists, anybody's. But here, I'm going to play that audio for you. This is our channel, Interlocutors International. She will tell you how the interlocutors, speaking with interlocutors, help her for fluency. She got confidence. That's what she told. This is more further. Yes. This is the testimony. Dr. Aisha, Grandmaster interview. Testimony of Dr. Aisha Murtala in her own words. Okay. Yes. Fine. If you can listen to it very carefully, what she told, maybe it will be an eye-opener for you. Maybe. Okay. Internet access, okay. Okay. Now, the other girl, one girl, she called me and she was literally at the verge of tears. She already sobbed. She's a very sweet little girl, I know. But somewhere she lost. She lost the finger of the father who was helping her. She tried to do something on her own. She's a very sweet child. Okay. She lost just because of 10 marks. Just because of 10 marks. Okay, fine. There's a different thing. I told her, don't do like this. No, sir, I cannot. I cannot. So she tried on her own style, in her own style, and she lost. Yes, I blessed her in many ways. But the point is, the child, when they try to do on their own, they cannot decide what is right and what is wrong. And especially when you know that you have a loving father, leave your finger in their hands because the father will hold you tight. You don't catch the father's finger and you're lost in the exhibition when you see the candy because you just drift apart and then your father is lost. You lost sight of your father. And there is nobody to save him. I'm not telling you that I'm something great. No, I'm a very ordinary teacher. I'll try to do the best for my children. That's it. Fine. Here it is, the interview. Okay. Now, she is a doctor. In the beginning, I told her many different things. She was taken aback. Maybe she was thinking that time, why did I join or schedule my test with Mr. Peter? Maybe. But today, she repents of what she had thought those days. It is there in the testimony. She told, in the beginning, I was not very comfortable when you told me that I will record your video in the Zoom lecture. She did not give me permission. And I posted her audios in the Telegram channel. She said, sir, you did not ask me. I said, okay, I'll remove them. I'm sorry for that, but this is my system. This is my system and I'm doing, but if you feel hurt, I'll remove them. And I remove those audios from the Telegram channel. But today she says, I now understand why you told. We never know because you are an expert. You are the best to decide things. So now I realize, because now I think I should give a message, even if one person gets benefit from my testimony. That is what you're going to hear in the testimony today. I will be very much happy, sir, she told. And I'm really very happy. I was doubtful. I was doubtful whether she will give me a testimony because she did not accept many things in the beginning. But afterwards, she was 200% obedient. She gave back all those things. Yeah. Hello, Dr. Aisha.
Hi, Mr. Peter.
Yes, yes. What about your results? I think you got your results today, right?
Yes.
Yeah, share your results. What score you got? First of all, tell me whether you have passed or not in all the 4 skills. I'm eager to know that.
Okay. Yes, I did pass all the 4 skills. And I'm really
Wow, that's a
happy.
wonderful news for us. Let us celebrate. Come on, tell me.
Yeah.
I congratulate you. Congratulations on your grand success. It was your first
Thank
attempt, I
you.
think, right?
Yes, this is my first attempt.
And you had training only for something around 2 weeks, I think, right?
Actually, 10 days.
10 days. You booked for a special crash course. Am I correct?
Yeah.
Yeah, share your
Yes.
experience. Why did you want to join with the classical corrections? Why did you want Mr. Simon to correct your letters and your speaking and your reading sessions and listening sessions? Why? What made you approach Mr. Simon?
Okay.
Yes.
Yeah, can you hear me?
Yes, yes, of course.
Okay, I checked on Google for a group to join for my OET study, and I just found Classical Correction Telegram and I joined. In the beginning, I actually was not active because I wasn't sure if I'm going to take the test or not. And then later on, I started checking the past questions. And okay, I didn't tell you this actually. Part of the written test that we had in the actual exam was part of your past questions or part of those files that you were sharing. There was one about smoking and the effect of people. It's about health policy or health priority. I am sure I did the test in your practice files and I got the same test in my exams. So I'm really happy. Anyway, after I joined the course, the Telegram group, I started going through the files and I started practicing. Then I think I don't know how I contacted you, but you sent me your number through WhatsApp. And I was skeptical to go with you, and then you said I should call you. I called you. We spoke, and I was convinced. So we had a 10 days crash course, and it was great because there we have it. The result shows, because I got 400 first of all in speaking, 390 in reading, 350 in writing, and 360 in listening. So I'm really, really happy.
So many people, many doctors are not able to secure quality results even after 4 attempts. Some are taking 5 attempts, 6 attempts also. And how do you feel when you got the result and you got first attempt you got success?
Okay, first of all, if I am to advise those doctors, I would say that practice makes perfect. Practice a lot and then get your guidelines, because you actually crash course it. You tell us what we need for the exams and not, it's a broad study. So you concise it and you summarize it to the point that you need for the exam for you to pass, because you have to know how to pass the exam. And that is what you teach. And thanks to your files, everything on there is authentic, because I can say, because I saw some part of it in the exam, even if I did not see, it actually coincide with the exam because it's similar in a way. And if you have any clarifications, anything that you want to clarify, I think speaking to you, you kind of know the tricks and tips for the exam. So it's good that one contacts you, and then the practicing session for the speaking with your assistants or staffs, it's very, very beneficial. At first, I was skeptical as well, because I was like, why do I have to practice with them when they do not assess me? I don't know if I'm doing it wrong or right. But when you spoke to me and told me, yes, I should just keep on, you can take a session or two with me, and then I should keep on practicing with them. It will help with my vocabulary and everything. I actually see the reward in it now.
Yes, there is no such institute which are providing interlocutors, but classical corrections is providing you 3 or 4 interlocutors. Okay, right. So
Yes.
is this system of interlocutors working well for you? How well it worked for you?
Well, at first, like I said, I did not like it because every time I ask the interlocutors, they would just tell me, you're going to correct it, you're going to correct it. And I actually wanted someone that would give me a feedback, and that was the reason for my payment and everything. But then later on, when we did it with you and you explained the reason behind it, meaning that it is to access my vocabulary and to get me used to the speaking pattern and how it's going to be in the exam, I understood it and I continued with your own guidance.
Okay, right. There are many doctors who are struggling, and if anybody asks you, tell us about someone who can teach us or train us, somebody who can guide us in the right direction. So, what percentage you can think about classical corrections or Mr. Peter's name to refer him?
Well, 100%. So, especially in the writing, because you give the right vocabularies to write. Because I understand these exams are just how would I say it? It's tricky. But once you understand their language and you understand what they need, that's all you have. You need for the exam. It doesn't really test your English knowledge. No, they have certain things that they want you to provide, and that is what you provide exactly. So you can just go and paste it in the exam, and you're going to pass. In my opinion.
Yeah. One last question. I asked you to go on with the interlocutors and practice for fluency, and you were a little upset and reluctant to do that one. You wanted somebody to guide you and tell every speaking session, you wanted somebody to give the suggestions, but I told no, wait, first you practice fluency, then you come, I'll give you accuracy, I told. So you listened to me, and after the 4 days or something like that, I started giving you feedback. So because you listened to me, you got 400 scores there. That is different. There are some students, they don't listen to me. If I say write and send it to me, I will give feedback. They say just give us voice note, or I don't want that much feedback, just correct it some points and give. So they are not ready to listen to me. They say, what is there? Many people are doing like that. They'll take them easy. So my suggestions are little tougher and stronger. So what do you think about that one? Do you want them, for example, if they ask you, what is the secret of your success? Okay. What will you say? No, I listened to Mr. Simon's words as it is. Whatever he told me, I listened to him. Sometimes there were sessions of 3 hours also before exam, correct? Especially reading and listening, correct? So 4 hours sessions also. You forgot everything when I told you to attend the sessions, you attended. Is that one reason why you passed in the OET reading and listening?
Yes, actually, it is because I followed every suggestion of yours, even though sometimes I felt there wasn't need, but I was really adamant. Sorry, you were really adamant, and I followed your footsteps and your suggestions and your rules, everything. The reason, because I feel like you have been training people that have gone for these exams, and their feedback is very important to you, and you utilize and use those feedbacks in order to train other students to become successful. So I will go with your advice because you have been in this training for a long time. This is my first time, so I wouldn't know what. I just believe you would do good to me. So I would follow your advice, and I did all the time. we spent 2-3 hours, like you said, correcting. Oh, especially my handwriting. We did not speak about my handwriting, especially my handwriting. You gave me hell with my handwriting, and I think that also contributed to my success.
If your handwriting had not improved, you would have got 340.
Yes.
Maybe everything. Okay. But if we had a 1 month time, then definitely you would have scored more than 400.
Yes.
Okay. One more thing. When I was taking sessions for you online, okay, I was trying to put on the YouTube. You were little feeling shy and reluctant, not interested. But afterwards, now I think you might have understood why it is important. The lecture which I gave you, it is for everyone, I told, not just for you. Correct?
Yes.
So, do you think that importance now?
Yes, it is important because it will guide other students as well. Before I was hesitant because I was just, like you said, I wasn't comfortable. But now I understand the concept behind it.
Actually, I was doubtful whether you will give me an interview or not in the first place. Because you come from a traditional background, and most of the people, they don't want to open up, they don't want to reveal themselves to the world, they want to hide like that. Many people are there like that, but still I thought maybe you will be little not ready to give me an interview, but you readily gave me an interview. What is the reason? Why? What made this change?
Well, I want, as much as this may sound, this English test can be a very huge test in someone's career pathway. Because it's English, you do not really take it seriously. I know of people that really just say, oh, it's just English. It is not just English. We actually have to sit down and study the way we're going to study the medicine. We should study this English. So if my feedback now is going to help one person, I will do it for that one person because I know how it feels. First of all, your money is gone, your time is gone. You will just be depressed and angry because of a simple English exam, which is not as simple as they say. So if it's going to help a person, I will do it.
Okay, today there was one candidate who called, and she was literally at the verge of tears because she could not make in one particular skill. She was literally crying. But the thing, before when I was telling them, be serious, you have to take some more training, they did not listen. But today, she called me and she was crying literally. Of course, they are upset. I am concerned about them. I have sympathy, love and affection towards them. But for such people who are not ready to listen before, so maybe you are an example. Now you are smiling and laughing. Actually, I was heartbroken, when your tone was normal. Then you were asking me, guess what happened? I thought maybe somewhere something hit you badly, and somewhere some 340 or something like that you got. I was thinking, and I was little hurt within my heart. Then afterwards when you said no, then I came back to my level of happiness. Then when you said I passed in everything, then I said, wow, that's so. Why don't these people listen? Instead of crying later, why don't they struggle before? Why don't they listen? I am like a father or a mother. I am telling them, guiding them, do this, do this, do this. Why don't they listen to me? You listen to me because you are a doctor, but still you listen to me. Then you 100% your obedience, you paid. In the beginning, of course, 2 or 3 days, you are not very ready to open up yourself. But afterwards, the remaining 7 days, you are full, double work and everything. But why don't people listen like that? What is your suggestion for such people? So whether to be self-reliant and self-confident, or when you cannot do, just trust your teacher or mentor or guide or counselor who is guiding you properly. What is your suggestion?
Well, I think the major problem is we do not take the English test seriously across all departments, medicine, be it pharmacology, whoever it is. Once it's an English, because for some of us that come from an English country or English speaking country, we just regard it as it's just the normal day-to-day speaking that we do. We have been writing in English since we were in kindergarten, so it's not going to be difficult. But actually, it is difficult because they have a certain set of syllables and also objectives that they need you to provide for them during the exam. So as you come as a mentor and a teacher and a guide, you have seen students that have passed, that have failed, and you have seen the category of each student, those that pay attention and those that don't. And you have seen the advantage of both, the advantage and the disadvantages of both. So I think you are in a very good position to advise someone that is going for this exam, because you know how tough it can be, how painful it can be, how expensive it is. Your words are actually to be taken seriously because you know the struggle that people go through. So I feel like for those students, they should listen to you, they should come for classes, they should be serious in the English, first of all, before even chasing all the things for their career, because this is the gateway. Once the gate is open, you can fly however high you want to fly, but you have to open this gate first. And to open this gate, you have to be serious.
Right. Lastly, I want to tell you once again, congratulations on your first attempt. Okay, though you came for a crash course, 10 days or something, and you attended full time, morning to night, whenever you are awake. Sometimes you did not sleep also, and you are waiting for my classes, right?
Yes.
So I really appreciate your interest, and hearty congratulations for that. And then what more is, what is it? Yeah, I want you to send a photograph, photograph of your certificate which you have got, so that I can share the details which cannot be used, so that others cannot misuse that one. Then I will just give it so that encouragement for the other students along with your this one. So maybe many people, many doctors will be inspired by your words. It's not that I need them, maybe they need the training. Okay, see, many doctors are teaching. You did not go to any doctor. See, for example, in some countries they are teaching in Arabic, or they are teaching in some other language. Yes, do you know that?
Yes.
So you
they're teaching the English then.
They did not, you did not go there. You came to Simon, sir. Maybe you thought that this is something different. You came with the trust that Simon is going to do something. So that is the reason why I am asking. And one more thing, I want chocolates from you. One chocolate, however, whatever cost it is, I don't mind. Okay, but I want a box of chocolates from you from the UK directly passed on to me here, and I have to share it with my interlocutors, because we know
especially Manju.
Okay, right. So Manju, say hi to.
Hello, Dr. Aisha.
Hello, Manju.
I
passed my speaking with 400.
Congratulations for that.
Thank you so much. Thank you, and thank you for your help. Thank you for always checking on to see who is online for the speaking test. Thank you for telling me it's almost time for me to close, but you have 5 minutes. Thank you for all of that.
Thank you, Dr. Aisha. Do you have any suggestions for us? How can I improve myself?
Well, I think you're doing a great job, really. In terms of the speaking, you listen attentively, and also you speak like you are the patient. You have the tone. You have the tone for the examiner or the interlocutor during the exam. So I think you're doing a very good job.
Thank you, Dr. Aisha.
Thank you so much.
That is all. Thank you very much once again, Dr. Aisha, and this is the end of the session. So you all can take the suggestions of Dr. Aisha and try to implement in your style, so that you can get, you can see the success traveling to the other side. Have a nice day, one and all. Bye-bye. Right. So we have heard the testimony of Dr. Aisha. So that is how you feel. Okay. That is how you feel when you get good results. She was beaming with joy and happiness. That is what I want. That is more valuable than all the money that you are paying. Because you'll be paying only for my services, not for the knowledge, because knowledge is free. You may be learning all on your own, or somebody from the books, from the internet, or in that matter, any way possible. So, we as teachers feel proud when our students, they quench their thirst and success. That's what it is. So all of you, this is just one testimony. Okay. Yeah. So now, yep. There we are. Fine. Greta Babu. Hello, Greta. Can you unmute?
Yes, sir.
Am I audible?
Yes, sir. It's audible.
Is the screen clear?
Yes, sir.
Was the testimony heard?
Yeah, I hear the testimony, sir. It's
Yes. So
inspiring.
somebody was messaging that they cannot hear anything. So that's why
No,
I asked.
it
Oh,
was
fine.
clear.
That's okay. Now, thank you. You can mute back. Now we are going with the lecture. Yes. Yeah, that is room B. Okay, fine. Okay. So here we are. Reading test part A. Yes. Fine. The use of feeding tubes in pediatrics. The use of feeding tubes in pediatrics. Okay. The use of feeding tubes in pediatrics. Yes. Now this is text A. If you see there, now you can see very clearly there is a heading for this. This is the heading, this is the title, this is the subject, this is the context. Write down the 4 words: subject, title, context. Subject, title, context. Label. Title, subject, context, label. Okay, fine. Whatever you want to say, that's different. So here, with this you understand that this is regarding What is the main thing in this? The main thing in this. Here, the use. So use is there, one noun. Feeding tubes. Tubes is there, another noun. Paediatrics is there, another noun. 3 nouns are there. And feeding is an adjective. Now there are 3 nouns which are important. Use, tubes, paediatrics. Is this about pediatrics? No. Is this about use? No. Is this about tubes? Yes. It is tubes in pediatrics. It is the use of tubes. It is about feeding tubes. Without the tubes, if you remove tubes, there is nothing. If you remove the word tubes, there is nothing. It is about tubes. It is about feeding tubes. It is about feeding tubes. So it is about the use of feeding tubes. It is about the feeding tubes in pediatrics. It is about feeding tubes. Feeding tubes. Not any tubes, but it is feeding tubes. Tubes that are used for feeding. So feeding tubes is very important here. Okay. So you are going to learn about these feeding tubes. Talk about these feeding tubes. Now let us see here. Right. Now you can see very clearly. You can see very clearly here. So there, pediatric nasogastric tube use. So pediatrics is already there in the title, tube is already there in the title, use is already there in the title. So what thing has come newly? Something different. That is nasogastric. Nasogastric. So that is very important. So the title, the next paragraph starts with that only, you see. Nasogastric is the most common route for enteral feeding. So nasogastric. What is nasogastric? It is explained. Something is nasogastric. Nasogastric is something. Is something means meaning. It is talking about meaning. It is giving an explanation about what is nasogastric. It is giving knowledge regarding nasogastric. It is giving information regarding nasogastric. It is giving a definition. It is giving an idea or a concept or a notion about what is nasogastric. So nasogastric is enough. Next one, inserting the nasogastric tube. In this subtitle, nasogastric is already there in the title, tube is already there in the title. So what new thing has come? Inserting. Inserting means what? Placing. Means procedure. Means action, putting in action. Okay, the steps, the measures. Now here, this is divided into 2 parts. This is the first one, and this is the second one. So here, you see 1, 2, 3, 4, 5, 6, 7 points. Step by step, this is the procedure or the action or steps or measures. And here, you can see there are 2 points, number 1 and number 2. First one is some type of bore. Second one is another type of bore. There are 2 different types for 2 different purposes. If one is enough, then why will they give 2? That means they are different. They have some different purpose. Okay, their goals are different. Because their style is different. Maybe their size is different. Maybe their shape is different. Or the type of bore is different. That is wide bore and fine bore. Okay, fine, that's clear. In general, tube sizes. So he's talking about sizes. He's talking about sizes. Range of sizes. Fine. Right. Now next. So here, these are the what type of nasogastric tube? What is the type of nasogastric? Which type? What type should be inserted? Inserting, but which type of tube should be inserted to what type of person? Okay, fine. Next one. And what are the procedures for inserting? So what to insert means what type of tube to insert? What, fine bore or wide bore? Which one should be inserted? The tube should be fine bore. So what type of tube should be inserted in the first place? And this is how we have to insert step by step. 1, 2, 3, 4, 5, 6, 7 steps. Fine. Next, the third one is related to aspiration. You have to check. You have to check. You have to measure. You have to test. You have to examine. You have to assess. Okay. First line using estimate. What do you mean by estimate? Measure. Measure. What should you measure? What should you measure? Okay. And see the fourth line, aspirate. Aspirate. Aspiration. Aspiration. And third line, measurement. Measurement. Try to understand. Measurement, estimate. What does this word show? So you have to aspirate with the syringe using gentle suction. Okay. That means you're testing for aspiration. You're checking, you're testing, you're examining, you're assessing, you are measuring, you're evaluating. Okay. So that is it. This is test. First one is general information about nasogastric tube. Nasogastric tube, general information. Nasogastric tube, general information. And next one is nasogastric tube, insertion, inserting. And third one, text C is nasogastric tube for aspiration. So checking. So tubes in general, then inserting tubes, checking tubes, and using tubes. Okay, this is aspiration. And if the aspiration is proper, then you will check pH. pH is 1 to 1.5 or between 1 and 1.5, 5.5, sorry, 1 to 5.5 or between 1 and 5.5. That means aspiration perfect. So you can feed them. If it is not between 1 and 5.5, you have to test again. You have to go for X-ray. A lot of things are there. And do them and coming back. And everything is proper, then proceed to feed. So this is proceed to feed, not feeding stage. This is not feeding stage. This is just testing stage. And here is the feeding stage. See, administering feeding, feeds via a feeding tube. Feeds and fluid. So fluid is also feed only. That is solid and this is liquid. Okay. Or fluid. Try to understand what he's telling you. Everywhere you will see feed, feed, feed. Feed bottles, feeding directly. Feed bottles. Should the feed be decanted? Then see, all feeds should be monitored. Oral feeding. Okay. Feeding commences. Feeding method. Everything is feeding. Everywhere you see it is feeding. So feeding, first line itself tells you. So this is administering, using, or the final stage, or the practicals. Practicals, real situation. Real situation. Fine. Good. Now let us see. Once again, this is about the general explanation, that is the meaning and definition. And this is inserting, means placing tube. Then checking the tube, whether it is perfect or not. Lastly, feeding. So now if you go finally, there is a style now. First one is the explanation, means general information. Why feeding tubes? Why feeding? First one is why. Then second one is how to insert. How to insert and what to insert. First one is why tubes. Second one is which type and how to insert. Which type to insert and how to insert, that is B. C. Second one, third one is C. Okay. So how to know whether it is right, perfect, correct. How to know, that is checking. Assessing whether it is going to work properly or not. Testing. Okay. Fourth one is everything perfect. So go ahead. No harm. So start feeding. Use the tube. First one is what is the tube and why we are using the tube. Second one is which type should be inserted and how to insert. Then third one is how do we know that it is correct. Fourth one is correct position and everything. Fourth one is okay, everything is perfect. Now you can go ahead with feeding. So first one is why tube. Second one is how to insert tube. Third one is how to assess the status of the tube, perfect or imperfect, perfectly placed or imperfectly placed, checking. Last one is using the tube, feeding the child or feeding the patient. That's it. So you now understand everything. First, general information everyone has to know. Second one is when problem comes, you should insert first. This is the preliminary stage. Preliminary stage. Preliminary stage. First thing what you do is you put it there. You place it. Then after placing it, you will test it. So first one is placing stage. Second one is testing stage. And the last one is implementation. Okay. So C is confirmation, B is construction, C is confirmation, D is usage, feeding. So that is how it is. So 4 different levels. First you should know what is this tube and why you are using this tube. Second one, how to insert this tube. Then how can we know that it is correct? Then last one, it is correct, then go ahead. That's it. So stage by stage it is going. Inserting, checking and feeding. You should know which level it is now, the question. Which level the question is, you should know. Now I'm asking you the question. One question. Have you understood the concept of how the subject or the train is divided or is separated into 4 watertight compartments. Have you understood the concept of how the train is separated into 4 watertight compartments? If you understood, type yes. I'm giving you just 15 seconds. Just 15 seconds. If you do not understand the reason for this, you're lost in the exam. Because this is, you should finish this test in 10 minutes. Those who finish in 10 minutes with appropriate reason and not a lottery system, they will get 400 above. Or even 450 and above. Yes. Now we are moving. Yes, come on. Go ahead. In which text can you find information about the risks of feeding a child via a nasogastric tube? The risks of feeding a child. In which text can you find information about the risks of feeding a child via a nasogastric tube? Come on. Type your answer A or B or C or D. Five, 4, 3, 2, 1, submit. You have to be ready like that. When I say submit, then you have to submit. Write in the chat box. Write in the chat box. Question number 1. Question number 1. There it is, question number 1. Come on, answer. Write your answer A or B or C or D. Yes, go ahead. Submit your response there in the chat box. I have put number 1. That means it is ready. You have to answer the question. Think about that. The risks of feeding a child via a nasogastric tube. Nobody is typing, or you're not able to hear? What is wrong? Yes, yes, Fetsile. Velile, she has answered. Correct, good, go ahead. All of you, type your answers, please. Yes, Jebin A. Elizabeth A, good. I'll explain you why this is A. Once you type. Fast, 10 seconds. Nicey A. Now, simple question I will ask you. Risks. Now, here you should ask the questions. During, before, during, or after. The risks you should know. The risks you should know. It should be an explanation, or it should be before inserting, or during inserting, or after inserting. When should you know the risks? Before inserting, or during inserting, or after inserting? Next, before checking, or during checking, or after checking? Before feeding, or during feeding or after feeding. When exactly is it this is risks of feeding a child via a nasogastric tube? Should it be before inserting, or during inserting, or after inserting, or before checking, that means in between inserting and checking, or during checking, or after checking, or it should be before feeding, that means after checking and before feeding, or during feeding or after feeding? When should we know of the risks? Is it in the inserting stage, that means while inserting, or before inserting, while checking or before checking, or after checking, while feeding, before feeding, or after feeding? I think you got the explanation clear. So the risks should be known. Just one word there. Yes. Just one word there. Fine. Okay, sorry. Yeah. So here it is. So we have the word here. Should we know about these risks? When? So that's it. Which is the right thing, you think? You insert, and while inserting you think about risks, or before inserting you'll think? So next, or after inserting you'll think about risks and remove it off, or before checking? Inserting is before checking, and checking is before feeding, and inserting is before feeding, and this risk should be before feeding, or before checking, or before inserting, or before everything of these three things. That means risks should not be during inserting, risks knowledge should not be during checking, risks not during feeding. Before everything, first and foremost, you should know about the risks. Okay. So you should understand that. So here the concept is before, during, and after. Before, the concept is here. This is the concept I'm going to place here. Okay. Before, during, and after. So this is the point. Before, during, and after. Before, during, and after. If you can understand this, that means everything is clear for you. Everything is clear. Okay. This is the concept. So in every question, there will be some concepts like this. Before, during, after. Which is before? This is something like procedure everywhere. Procedure for inserting, procedure for checking, procedure for feeding. Everything is a procedure. So whenever you find procedures like this, which comes before, which comes during, and which comes after. Feeding comes after checking. Inserting comes before checking. So checking comes between inserting and feeding. First comes first, last comes last, and between comes between. That is, if you can understand. And there are something irrelevant to this, that is explanation. Explanation, risks you have to explain before the beginning itself. Before you touch the tube, before only you have to give everything explanation. So that is the point. Concept clarity. Concept clarity. So you can write, yeah, whether you understood the concept or not. So just write yes. Okay. So you can write so is the concept clear? Just type, okay, how much so that is it. Right. So next. So I'm teaching concepts because I have already taught these things. I'm teaching the concepts now. I'm teaching you the concepts of how they are working. So the question you have to ask is before, during, and after. Okay. Right. Now the next question is here. This is the next question. Pass screen. Okay, I have passed the screen for you. Okay. So, right, second question. Go with the second question. Okay, resume screen. So here, in which text can you find information about calculating the length of the tube that will be required for a patient? that will be required for a patient. So where this person requires length of the tube, okay, right, where he will require, is it in the checking stage or explanation stage or feeding stage or inserting stage? A, explanation stage; B, inserting stage; C, checking stage; D, feeding stage. So where will you require? You require when? During the explanation or during inserting? Or so before inserting you require, or before checking you require, or before feeding you require? This is everything because of before, during and after. Or do you require during explanation or during inserting stage or during checking stage or during feeding stage? Or do you require after explanation stage or after inserting stage, after checking stage or after feeding stage? Everything it is there. Will be required, future. That will be required. Calculating the length of the tube. That will be required for a patient. When the patient is there. In explanation, okay, or during before insertion, or before, during or after checking, or before, during or after feeding. So here, the length of the tube. Send me the length of the tube. Okay. Send me the length of the tube. Okay. Send me the length of the tube. Now here it is very clear now. Okay, now let's go there and find out. Length of the tube. Will you need the length of the tube while checking the tube, or while inserting the tube, or while feeding the tube? Length. Okay. Checking stage means already inserted. So you will calculate after inserting, or will you calculate after checking, or will you calculate after feeding? So after is not useful. Okay. It is not definitely after feeding. After feeding, what is the need for calculating the length? Already checked. Already checking is done. Checking, everything is perfect. So now why do you need to calculate after checking? Inserting. You already inserted. Then why you calculate? That means after inserting, you remove and calculate again. So now during feeding, you'll calculate? No. Already it is inside and you're already feeding. So during checking, you will calculate. Already put inside. Then you will check. Calculate the length. Okay. Right. During inserting. You're already inserting. Half inserting is done. Not during. Already some part of the tube has gone inside. Then you will calculate the length. So definitely not during. It's not after inserting, it's not after checking, it's not after feeding. So now during, is it during feeding? No. Already half feeding is done. So during feeding, you'll know. So during checking, you're checking now. Then you will calculate? No. During inserting, then is half it has already been inserted. Then you will calculate the length? No. That means not even during. Now before feeding, that means after checking? No. After checking, not even checking. So how after checking? Okay. Before checking, that means after inserting, you calculate the length. Huh? It is not even during. So how can it be after inserting? Not during inserting. So how can it be after inserting? So fine, no. Next. Before feeding means after checking. Even before checking means after inserting maybe. So it stands wrong. Before inserting you have to calculate, then you have to insert. Maybe that is it. Or explanation. When it is. I'm just giving you the reason. Now, when will you calculate the length? Definitely before only. But before what? Before all the three? Okay. That means which stage you are? Definitely not feeding stage maybe. Or definitely not checking stage. Definitely not inserting stage. Definitely not explanation. So which stage it is? Now, the point is there with you. Again, the same point rises. Same point rises. Question number 2. Submit your answer. So submit your answer. Yes, type your answer A, B, C, D. Come on fast. So this type of questions which are based on procedure, okay, before, during and after. You ask everywhere and the answer is very clear for you. So type your answer fast. 10 seconds, A or B, 5, 4, 3, 2, 1 and submit. So these three are the stages. Explanation can be given anytime. Okay. In general, even those who don't need this also, they can get this. This is totally separate. These are totally separate. General information for everyone, general. But main things are inserting, checking and feeding. First you'll insert, then you'll check, then you'll feed. That's it. You need to know the length of the tube. Okay, it is before everything. In the beginning, you have to know the length of the tube that is required. Then you will insert. After inserting, you will check, and after checking, you will feed. So what to insert, which type of tube to insert, what is the length of the tube to insert, should it be a fine bore or a wide bore, you should know even before everything else. That means before inserting, that means inserting stage. At least 1 minute before inserting, you should know. You should calculate the length of the tube. 1 minute before inserting. Fine. So simple as that. Before. Next, the concept is so simple. Before, during, and after. This is one level of concept which will be used every time. Now the third one, question number 3. Question number 3. There is question number 3. In which text can you find information about when alternative forms of feeding may be more appropriate than nasogastric? Alternative forms. Alternative forms, that means not nasogastric. Other forms. Not this one. Any other. Alternative forms. Not nasogastric, but something else. So, not a nasogastric, but something else. Not nasogastric. Something else. Some other forms of feeding may be more appropriate than nasogastric. So, now listen to the same style again. So, other forms, will you use before inserting the tube or during other forms? And what tube you are inserting here? What type of tube you are inserting here? Remember, what type of tube are you inserting here? Is it nasogastric or not nasogastric? Finished. Alternative forms means not nasogastric. But here inserting what? Nasogastric. So this is not nasogastric at all. So we are not inserting that other things. And explanation. Explanation regarding nasogastric. Correct. But if you see clearly, there is one odd man out. Inserting what? Feeding tube. Which feeding tube? Nasogastric. So B is what? Nasogastric or alternative? Okay, explanation. Explanation is what? Regarding nasogastric? Yes, definitely. Then what about others? Maybe. Maybe. He's telling what is nasogastric. He's giving an explanation, and why is it used also is giving. Okay. If there are other forms useful, try to use them also, they may say. This is not 100% of the picture regarding explanation. Nasogastric is one. General explanation may be one. But there may be other side of the coin also. But inserting what? You see the title itself. Nasogastric. Okay. So first one is nasogastric. Use of nasogastric feeding tube. So nasogastric. So where to use nasogastric tube? Using nasogastric tube is explanation. So when not to use also maybe there. Risks are there, no. If there is risk, don't use that one. Use alternative forms, maybe. He's telling use nasogastric. He's telling use nasogastric. He's not using, he's telling use nasogastric feeding tubes. So when he's telling use nasogastric tubes, there may be problems. That is what we have seen in the previous question, risks. This question is there already in the first test, question itself. Why? There are some risks. So if that is risky, use alternative forms, maybe. So maybe in the explanation. Okay, fine. So why should we use alternative forms? If nasogastric tube is perfect, then why should we use alternative forms? That means there is something wrong. Or there is something even better, more appropriate. So that means, why more appropriate? That means this is less appropriate, nasogastric. That means there is a problem. And when there is a problem, avoid that problem, use alternative. So where you will find? When you are inserting, you will use, think about alternative. Or when you are checking nasogastric tube, already you decided that nasogastric is the perfect. That's why you are inserting. After inserting, you are checking. After checking, you are feeding. In the inserting, before inserting only, you know that it is perfect. That is why you are inserting. So when you are already inserting nasogastric tube, where is alternative there? Already you thought that it is perfect. So why do you need alternative when you are inserting? So you need alternative before inserting only. And when you know that there is a risk, so before inserting, and checking happens after inserting, feeding happens after checking, which is after inserting. So alternative tubes, alternative forms will be before feeding and even before checking and even before inserting, because there is some problem with nasogastric. That is why you are using alternative. So it cannot be feeding, it cannot be checking, it cannot be inserting. Therefore, it may be the explanation because other forms. If it is only nasogastric, then it may be inserting. If it is only nasogastric, then after crossing inserting, there will be checking. And if it is only inserted and checked when it is perfect, then only feeding. So, inserting because you know that it is appropriate. If it is not appropriate, why will you insert? Are you mad to insert nasogastric tube when you know that it is inappropriate? So that means you will confirm that it is appropriate, then only insert. Without thinking that is it useful or not useful, will you insert first of all? So before you insert the nasogastric tube, you will check whether it is appropriate or not. Then only you will insert. After inserting, you will check whether the insertion is right or not. Then after checking, you will test whether everything is fine. Then only you will start feeding. So you should find whether it is appropriate or not appropriate even before inserting. That is in the explanation only you will find. Maybe I'm just reasoning it out. Maybe I am right. Maybe I am wrong. I am least bothered about it. My only direction is to give you thought-provoking ideas. Brainstorming. I did not give you answer. I gave everything. All the points I have discussed. How the brain should work. Now, forget Simon sir. You are your own boss. Okay? You are your own boss. Now, what you have to do is, okay? Now, what you have to do is, question number 3. Yes, I have sent number 3. Come on. Now you can feed your answers. Come on, A, B, C, D. Type your answer, please. Come on, fast, 10 seconds. Think. You have your judgment. You are wise enough. Think and answer fast. My students are already getting 400, 420, 450. Now I am targeting for above 450. I don't mind whether only one student is coming or 2 students are coming. I don't mind. But the students, they should be extraordinary. Simon says a student should be extraordinary. That's it. That only students, you can make me special. I am not special. I am a very, very ordinary or simple or common or mediocre teacher. You can make me special by your marks. Come on, type your answers, please, first. Yes, type your answers. Okay. So that's it. Next. Okay. Now I am asking, do you can you follow the reason? Can you follow the reason to question the question? When you want to answer some question, you have to question the question. You have to question the question. Somebody says, somebody asks you, will you ask me? Will you teach me English? Then I'll ask my student, why do you want Simon sir to teach you English? What is the reason behind it? Then I'll know whether the candidate is really serious or not. Sir, I want to clear OET. So your reason is you want to clear OET. So the reason is you only, you want to clear OET. Then why are you coming to me? You're telling, I want to clear those. I want to clear. Then why are you coming to me? Don't come. I can understand from that this person is I, not I will do what you say. So why do you want to come to me? Don't come. I'm not requesting you to come. Stay away from me. There is one student. Okay. She told me like this. It is there on my Telegram channel. Everyone I ask this question before registering. Only if I'm convinced I will give them admission. Nothing like that. Give me one reason why you want to study with me. I'll teach too much. Many people run away from me. They don't want to study with me. Why? Sir, I have seen your YouTube channel. Every video I have seen, sir. Please give me admission, sir. Okay. Yes, there are many people like that. I'll check and I'll give. So they say, I have seen your YouTube, sir. Your explanation is little different, sir. Nobody teaches us like this, sir. I have gone through, I have studied many, I have visited many lectures, sir. Many people say that nobody can teach you English. You have to learn on your own. They just throw the material at us, sir. Poor people. That is what they do, because they don't have the arrows to kill the ignorance of wisdom. Okay. Ignorance of wisdom. They don't know what is wisdom. They themselves don't know. Then how can they teach? Then just give you material. Read on your own. Because they are not strong. Yes, sir. I failed 3 times, sir. I studied with many people, sir. Your technique is different, sir. So I'm able to, I learned many things, sir. So if I study, definitely I can. So then I'll say, okay, I'll give you admission. So don't come to me. If you say, I want to clear OET, don't come to me. If you say, I want to master OET and I know that you can help me, then you come. Otherwise, don't come. Okay, fine. So, next, third point we have seen here. Next, fourth one. Today is going to be a workshop. I'm converting it to a workshop. Okay. I'm going to teach you a lot of concepts. Okay. Bear with me. And if you're tired, go and sleep. But I am moving on. This is going to be a non-stop nonsense. Think whatever you want. Because I tell you once again, I don't teach for you. You are not the reason why I am teaching. I won't teach because I love teaching. I teach to please myself. I am not a people pleaser. Okay. So here is the question. Fourth question. Now let us see here. Fourth question. And whenever I give lectures, I don't even open the mics of the students and ask how anything. Okay, I will not allow anybody to consult over a patient's liquid food requirements. Liquid food. Liquid food. Who to consult? Who to consult? When is food required? Food, food, and food. Food, food, and food. That is the clue for you. We can find out which is the most food requirements. Liquid food, patient's food, consult for food. Who to consult for food? What does the patient require? Food. What type of food? Liquid food. Food, 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 food is the operating word which will take you to the answer. Every other word will depend. It's not requirements, it is food requirements. Food, food, food. Without food, requirements is not useful. But without requirement, food is enough. Liquid is not enough, but without liquid, food is okay. Without patient, food is okay. Without person who is a doctor, food is okay. Because without doctor also, he needs food. Without consulting the doctor also, he needs food. You need to consult only what type of food he needs. Food he requires. And liquid food he requires. Without anything else, still food is there. You can see there. That's enough. That is enough. Now think about the answer. For this one, do you want to go to the test? Nonsense things given 100 words or all the four texts. Text A, text B, text C, text D. Do you want to go to all the 4 texts? And even after going to one text, do you want to read everything? No need at all. Come on, write down. Okay. Now 1 second. Let me say number 4. 1 second. 1 second. Only after writing the number, you go there. Okay. Please. Chat box number. After write the 9th number, then you have to send. And that too, I will count. Yes, 5, 4, 3, 2, 1, and submit. Come on, fast. Fast, fast, fast. Yes, only 2 students have written the answer, Elizabeth and Jabin. And the third one, there will be some people who will be leaving, let them leave. No problem. Those who stay will become mountains. Those who are washed out will be dust and washed. Let them wash, no problem. You want to be a mountain or you want to be the soil which is washed away by water, the flood. That's it. Okay. This lecture is not ordinary lecture. It is like a flood. You want to stand firm like a mountain or you want to be washed like the soil. You decide for yourself. Okay. Next question. So question number 4. You will know the answer directly. Print the screen. Okay. That's it. Annotate. Clear drawings. Yes, question number 5. Question number 5. Yeah. Already testing is done yesterday. This is my explanation. I'm not testing you anything. Already discussed answers. Those who did not discuss the answers here, those who did not do the test with me yesterday, okay, for them it is different thing. But those who have already done, it is not your test, it is my explanation. Actually, I'm giving an explanation because we are moving into the second stage today. That means scanning stage. This is only skimming. This is only skimming. But for the next set of questions, you need to have scanning and even solving. Okay. Now, Right. The outward appearance of the tubes. The outward appearance of the tubes. So simple as this. Outward appearance of the tubes. That means you are seeing the appearance when the tube, you are seeing the tube. See the outward appearance. When you see that, when you keep it there, you see the outward appearance. You cannot see the inward appearance, but you can see the outward appearance. Okay, now, when you can see at the entrance also, you can see the inward appearance also. But the outward appearance of the tube, when you can see, before inserting, that means when it is out of the body, or after inserting when it is in the body, or during in feeding when it is in the body. When will you see the outward appearance of the tubes? Okay. Inserting stage, that means before and inserting stage, or before and checking stage, or before and feeding stage. When? These are the three stages. Okay. When you can see the outward appearance of the tubes, where you will find this one? Is it inserting? That means you have to select according to the appearance before inserting, or appearance before checking, or appearance before feeding. Before checking means it may be after inserting also. Before feeding. Inserting is before feeding, but before feeding may be after checking also. After checking everything, why do you need to see the outward appearance? You need the outward appearance when? Before feeding, or during feeding, or after feeding. Before checking, or during checking, or after checking. Before inserting, or during inserting, or after inserting. When you will use this? Okay. Appearance. When do you need this appearance? Before inserting? You will think about appearance before inserting, or after before checking, or before feeding, or during inserting, or during checking, or during feeding, or after inserting, or after checking, or after feeding, or totally in the explanation. Okay. Now, next point is, yes, question number, this is question number 5. Yeah. Yes. Hit your answer, 10 seconds. 10 seconds. Participate actively, please. Because we are going deeper into the subject from 7th question onwards. Deeper, and you are going to get the diamonds. Now you only got the stones. Those are even serious questions. First 5 questions, all are easy questions only. If similar questions are asked, all are easy. So this stage is easy for everyone. Next stage is second gear, that is scanning. That is even tougher than this. And third, 16 to 20 questions are even tough. That is third gear. So how will you be able to do when you cannot do these things? 9 students have marked the answer, and the other 2 are my screens. One is my laptop and one is my computer. All the students participate. See how I notice everything. Okay. Right. Fine. Now here, my floating meeting control. So appearance, when do you find appearance? When do you think about the appearance? Before, during, or after? Inserting, or checking, or feeding? Which stage in which level? Okay. So you have to understand that. The keyword, there are many keywords, but the operating word is appearance. After inserting, no appearance. Checking is after inserting, so checking is ruled out. Appearance when you need? When you are feeding? No. Before feeding only you need. So after inserting, then you are feeding. So feeding is lost. So C and D are gone. That means B and A are needed. So explanation is general explanation. We don't need to have the appearance. We need to have the appearance only when you are ready to feed that person. So it is not in the explanation. Before feeding, okay, before feeding, before checking, and before even inserting. That means inserting stage. That's how you go. Think logic. Okay, do you find the explanation useful? Do you find the explanation useful? Okay. Because if you attend such sessions, 10 sessions are enough. If you do everyday test, even 100 tests will not help you. Doing with logic, doing with reason. Yes, hit the button in 10 seconds. Please, fast. I need it. Nobody tell. If only 2% give, then I'll give 2 more examples and close it off. If everyone gives, then I can move forward to the next stage. You know? Next. If you do like this, just in 5 to 7 minutes, you will finish all the questions. And that means you will get A grade. Definitely. No doubt regarding that. Okay. Sixth question. Here is the sixth question. Knowing when it is safe to go ahead, knowing when it is safe to go ahead with the use of a tube for feeding, to go ahead for feeding, to go ahead, ahead means move ahead for feeding, means when. This is enough, ahead for feeding. These 2 words. Otherwise, you take this word safe for feeding or ahead for feeding. Okay. Knowing when it is safe. Knowing. When will you know that it is safe? When will you know that it is safe? Safety. How do you know that it is safe? How can you confirm that it is safe? There was the same doctor last time. Yeah, I think there was one doctor. Yeah, the same doctor. When I was teaching last time, she was telling, "Sir, why are you shouting?" When I feel happy that my children are learning, I shout like that. Out of happiness. Out of happiness. Extreme happiness. Children dance. Why they dance? Because they are happy. We are human beings. Not only children. Anybody will start dancing. Anybody will start singing. Anybody will start shouting. Wildly, madly, they'll talk, do all nonsense when they are very, very happy. Not because they are mad. They're extremely happy. So that's it. So safety. How can you confirm that it is safe? When you do what? When you explain, do you know that it is safe? Or when you insert, do you know that it is safe? When you check, do you know it's safe? Or when you feed, do you know it's safe? How can you know that it can go ahead? When you explain, or when you insert, or when you check, or when you feed. But feeding is ruled out because it's before feeding. So that means D is already ruled out. So A, B, C are left. Okay. So when to move forward? When to move forward for feeding? It's very clearly present there. When to move forward for feeding. So inserting is the stage when you will move forward for checking. Feeding is the stage when you will move forward. Checking is the stage when we will move forward for feeding. So inserting will be the stage when you know that The explanation is there. So after inserting, you'll go for checking. After checking, you'll go for feeding. So when do we know that it is safe? So inserting, then checking, then feeding. But safety, how do you know? How do you know? Knowledge that it is safe. When everything is perfect. How do you know that it is perfect? You have to test. I don't know how you are going to do it. You have to evaluate. You have to assess. You have to examine. You have to discover. You have to find. You have to do research. So now the question is in front of you and you are going to answer the question, and the question number is, I'm sending you here, 6. Yes, there is question number 6. Now 10 seconds for you to shoot the answer. 5, 4, 3, 2, 1 and submit. Submit your answer. So these are the keywords. Knowing is the keyword. Safe is the keyword. Ahead, go ahead is the keyword. Feeding is the keyword. All are keywords, but the operating word is safe, safety. For example, you lock the house and then you pull the lock. Why? To check whether it is coming into your hand or not, whether it is opening or not. For example, you park your scooter, lock your scooter handle, then you will just shake the handle and check whether the lock is perfect or not. You check, you check, you check. That is whether it is safe or not. You check. That's it. Right, the screen. You go to the doctor, there are many people. There are almost 20 to 25 students enrolled with me in different batches, morning, afternoon, evening. But you know some students, what they do? They pay the fees. And then what they do, you know, they don't attend the class. And afterwards they want to see just in half an hour, the class which happens for 1.5 hours or 2 hours or 3 hours. They want fast food. Okay. They decide on their own style. They want to learn in their own way. They go to a doctor. Doctor, I have stomach pain, doctor. Okay, I will give you medication. Follow that. Okay, doctor. They go home and they keep the medication there. They forget it. Next day, they'll go to another doctor or they'll go to the same doctor. Sir, I did not get, the problem is still there, doctor. Did I take the medication? No, doctor, I did not have time. I did not think about it. I forgot, doctor. That's all. So why are you coming to me again and crying? Huh? You're so stubborn not to change your styles. You're going to a doctor, asking him to cure your disease, sickness, ailment, and doctor is giving some medication. He told, use this medication at this time, this time, this time, this time. Okay, you don't bother, you don't take medication, and again going to the same doctor and telling them. And you'll go to another doctor and say, I went to that doctor gave that medication, but now still I have this problem. But you are not telling that what is the problem within you? Huh? That is the problem. Be careful. Be careful. I am nowhere the loser. Nobody need to praise me or appreciate me. I already got a Cambridge University certificate. I don't want anybody to say you are the best or you are excellent, you are this, you are that. I don't want. I'm a very ordinary teacher. I know it very clearly. And only my students' results make me proud. That's it. Today the doctor passed but I'm not very happy. I'm just happy, nominally. But I'm sad because I lost one A grade maybe. If she had joined before 1 month, maybe she would have given me B plus, or at least B plus or A. So that's why, I want those people, 2 students or 3 students who will give me A grade, not just pass. I don't want just pass candidates because I don't want to be a just pass teacher. Okay. Question number 7. Now, the question number 7 is here. So simple as that. If you see one word, that is enough. One word. Okay. One word. Can anyone type? I have given you 6 explanations till now for 6 questions. I want to give you one word. I don't want keywords. I want the operating word. One word. Many lectures I have used that word. If you can find that word, you type there. 3. Type the word, operating word. OP, not the keyword. Operating word. I asked you to write one word, Elizabeth. Elizabeth, I asked you to write one word only, and you are writing 3 words. Okay, you are not following my words, first of all. I told you to write one word and you are writing 3 words. How come? That means you are very poor in listening. That means you are going to lose in listening if you don't listen to me properly. I'm telling one sentence. You are not able to listen. I told write one word. You wrote 3 words. Then what you will do in the exam? Here, one small test you are not passing. How will you pass in the exam? I did not ask you to write ABC, my dear. I did not ask you to write ABC. I asked you to write one word in the question. How regularly different kinds of tubes need replacing? Which one word can be called as an operating word? Yes. Come on, nobody wrote. Come on, think about it and write. One word I want. Smita Kanta regularly. Come on, what about the remaining students? Come on. Cinemol, how? I already told you I have used this word number of times. And this will be every reading part A, it will be there. Every reading part B, it will be there. Every reading part C, it will be there. Yes. Can you find that one particular word? I'll give you now. I'll give you now. How regularly different kinds of tubes need replacing. Somebody has written often. Where is the word often in this? You have brought somewhere from the sky and put your answer there. Yeah, let me check now. If anybody has given the correct answer. Nobody. No one. No one. Second try, come on. This will be a lesson of your life. This will be definitely in a free test. Come on, I'm giving you a second try. Try. Second. One you lost. All of you lost. Now try. Come on, all of you. Hit the buttons fast. 10 seconds. 10 seconds. We already discussed also this in the question. Very sad, very sad, very sad. Let me check. Still nobody correct. I'm giving a third chance. Come on, fit in. Giving a third chance, last chance. Last chance. Last chance. Come on. Come on. Come on. Come on. I know that nobody will give the answer right. I know that. That is why you are students and I am your teacher. Yes. Come on. Come on. Anybody. Anybody that ends there. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, submit. Last two answers are right. One is Juliet and one is Elizabeth. Last two. That means you have to dig deep, then you will get to the point. I told you no one will tell. That's it. That's it. Kinds. Tubes is common. Tubes need replacing. Different tubes. Regularly replacing. But what? What? Kinds is the important word. Every time I tell kinds, classes, types, write down the words. Classes, categories, types, kinds, varieties. Write down. How many types I have told you? Even this lecture also I have given you. Kinds. So how many kinds are there? 2 kinds are there. So you should know which kind you have to feed or check or insert. So when do you know which kind of tube need replacing? Yes. So kinds, where are kinds? Kinds are there in feeding, or kinds are there in checking, or kinds are there in inserting, or kinds are there in explanation. Okay. After inserting, you will think of kinds, and because they need replacing. After checking, you need kinds and need replacing. After feeding, you need kinds or replacing. After explanation, before explanation, you need kinds and replacing. When? General information, that is meaning, that is definition, that is explanation. Okay, I told you 2 slides are there. The first one is which type of tube that tube is to be inserted and how they have to be inserted, the steps. Kinds of tubes to be inserted and steps to be inserted. Kinds of tubes for inserting and how the procedure to insert. So we have seen them. Okay. We have seen there. Before inserting, you should know which kinds are there. How many kinds are there? So in inserting only, it will be there. Maybe. Or after inserting. Okay, when you're checking, you know which kind. Before, during, or after. So before feeding or before checking or before inserting, you should know about the kinds and their replacing. After inserting only, you think of replacing. Or after checking, you need think of need replacing. After feeding. So definitely not after. Okay, during feeding or during checking or during inserting, definitely not during. So it should be before something. Before feeding, yes, before feeding, but not after checking. Okay, before checking, not after checking. Before inserting, not after inserting. So ultimately, before feeding, before checking, before everything. That means before inserting. Maybe. So try to understand which is the right answer. So think about like that. Logical reasoning is very, very important. So question number 7, countdown started. 5, 4, 3, 2, 1, and submit. Submit your answer. Yesterday you already did the test. Now think like that and give your answer. This is called mastering English. This is called becoming proficient in English. Just to doing some answers. 1 minute you finish one test and question and you go off. That is called mastery. That is called proficiency. That is called playing the fool. Okay? Playing the fool. Okay? Wise people have to learn in a systematic manner. Okay? Why am I explaining so much? Because you're not used to these things. Because your teacher loves you very much. That's why he's explaining all these things. Yes, 7th question. I never told you any answers. I'm just showing you how to reason. I will not give you the answer. You find the answer yourself. You find the answer yourself. Okay. That is it. So now my question is, okay. Okay. Is, okay, the concepts that I'm explaining or in the explanation okay, are they full of common sense or they are full of nonsense? You write whatever you want. You write whatever you want. Just I want your answer. Just I want your answer. Even if you say nonsense also, I'm happy. But just write your answer. 5, 4, 3, 2, 1, and submit. And those who write common sense or nonsense, you stay continue. And those who don't write anything, just go and sleep. Because we are going to deeper points. If you cannot realize whether it is common, even if you say nonsense, it's okay for me. But if you don't realize whether it is common sense or nonsense and you are not interested, so there is no meaning of staying on the platform and wasting your time further. So Jabin, Elizabeth, Sinimol, Rajya Lakshmi, Sinimol, 2 times. Sinimol, Augustine, Sinimol. This is Sinimol, Sinimol. Sinimol to me. This is Sinimol, and this is Sinimol, Augustine. Okay, this is Sinimol Ajo, I think. Type your name, Sinimol Ajo. This is why I tell you, write 2 names. Is this Sinimol Ajo or somebody else? Maybe newcomer. If you are cinnamol azole, type AJO. If you are not azole, type your second name. Biju or Thomas or something else. Okay. Cinnamol. Chakko. So this is not even cinnamol ajo. So this is cinnamol chakko. So cinnamol ajo and cinnamol Augustine are our regular students. So cinnamol chakko is a guest now. Very good. Welcome. I can understand now. I know. You're a new candidate. I know. Fine. Yeah. Thank you for telling your name. Fine. So now we are moving to the oh. I passed there and I kept like that only. Yeah? Sorry. Okay. Now we are moving to the 8th question. See, I did not change the question only. Okay, fine. I put it in the Telegram channel. When I was explaining, but I did not remove the pass screen. So you could see only one question, I think. I'm really sorry for that. Okay, YouTubers might have missed. Okay, fine, no worries. Mistake is a mistake. I have to be careful next time. Okay. If anytime you see that the screen is not changing, just message me, sir, change the question. If you see the question number 3 continuously, and I'm teaching question number 4 or 5 or 6, okay, and you're not able to see because the screen is passed. So just remind me to change the question. Okay, fine. Okay. 7 questions over. Question number 8 to 15. Question number 8 to 15. You have to write a word or a short phrase. Now let us see here. Okay. So this is it. In which text can you find information about what type of tube should you use for patients who need nasogastric feeding for an extended period? So one word which is very important. You already understood what is scanning and you already understood what are the important words. Now I am going to ask you, identify one word which is very, 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 very important. Critical word. And type that word and keep it ready. And when I ask you to submit that word. Okay. Submit that word. Question number 8. Question number 8. Okay. 7, 6, 5, 4, 3, 2, 1. And submit. Smita Kanta has written type. Rajalakshmi has written type. Come on. Any other word? Jebin has written type. So now, come on, fast, fast, fast. We don't have all the time in the world. Okay. So all the students have written type 1, 2, 3, 4, 5, 6 students. Okay, good. Fine. So type. Now, because it is type, where will you use type for explanation, type for inserting, type for checking, or type for feeding. Where? Before what, or during what, or after what? Now, yeah, based on that one, in which text will you find this information? Come on, type and keep the answer ready. A, B, C, D, type and keep ready. Don't submit. Don't submit. 7, 6, 5, 4, 3, 2, 1, and submit. Yes, there you go. Okay. Sinimol wrote B, Rajalakshmi wrote B. Come on, what about the rest? Fast, fast, fast. Active brain. Because active brains are filled with fluid, gray matter. And empty brains are devil's workshop. Yes. So now let us see how many of you have written what. So only 6 people are active. That means they are doing something. 1, 2, 3, 4. Others are sleeping. Okay. Let us sing a lullaby for them. Okay. Because I'll see 3 more questions, and if they are not answering, I'll remove them from the session. Fine. I'm like that only. Okay. All right. So next one. That's very clear. It's very clear now. So now we have gone through this. So from this word, very good. Remember, when I tell you important word, that means you have to think about those important words. So your mind is already ready what types of words, because you are doing now practice with Peter. You're not doing practice on your own. It is practice with Peter. Practice with Peter. So this is not the right word. This is everywhere. So this is what type? What type? What type? What type? Which type of tube should you use for feeding? So that should be already checked and confirmed. Even before checking, you should know that it is already inserted. And that type of proper type should be inserted, then only you will check, then only you will feed. Improper type you will insert, then you cannot check, then you cannot feed, because again you have to remove that one and put the proper type. So proper type of tube should be inserted if it has to be for extended period. So where you will find that is in inserting, that is in text B. Text B. Type is before inserting, you will check which type. Before inserting, you will check which type you want. So this is the operating word. All the other words which you think they are important words, they are keywords, but not the operating word. Type will take you to inserting. You will select the type, then you will insert. Then after inserting, you will check. After checking, you will start feeding. That's it. That is it. Okay. Now we are moving to the second round, second stage. That is called scanning. Deeper, deeper, deeper. Not the deepest. This is already deep. This is already deep. Next one is the deeper one. Okay. So print the screen. This one will be in 3 layers. This is first layer. Then second layer is in B. There are 2 levels again. Okay. There are 2 levels again in B. This is 2 levels. What to insert, that is type, and how to insert, that is procedure. What to insert, that is type, and how to insert. I wrote spelling mistake. I did not check also. See, even teachers make mistakes. Okay. So that is why. How to insert? First one is what? What type to insert? What type? See there. Not how, but it is. The question is what type. The question directly points out to what. So first part of the sentence type or second part of the sentence steps. What type of tube should you use for patients who need nasogastric feeding for an extended period? So the question itself is giving you a clue, and the clues is scanning both the things. This took you to second part B, and in that one, this will take you to what type to insert. What to insert? Is it fine bore or wide bore? What type to insert? Fine bore to insert. Fine bore is a type. What type? Or wide bore to insert. Wide to insert. Or how? How to insert? How to insert? So in these two things, which do you think? Which do you think? Okay. So you have two different things now. What type? Okay. Now, two parts are there in this question. So now which is the right one? You have to find out. Yes. Now, write down 1 or 2. If you think 1 is right, write down 1. That means first half. If second one is right, that means second half. Come on, write down 1 or 2. 1 or 2. I told you this is practice with Peter. I'm telling shoot, you will shoot. I'm telling fall down, you will fall down. I'm telling run back, you will run back. I'm telling you chase forward, you will chase forward. So that is what it is. Practice with Peter. I'm telling you. Okay. And now your dolls, like how I'm telling you, you do, so that you'll find the steps. You'll not miss a beat. Come on, fast. 1 or 2. I want all the answers there. Fast, fast, fast. Quick. 9 students are there. Quick, quick, quick. I told you already, those who are inactive will be removed. I don't mind. You can watch from the YouTube. No doubt regarding that. Just to put 1 or 2. Yeah. 6. Still 3 are remaining. Okay. Yeah. Type, the word I already brought you here. So that is not much important. So what type is important? So you'll find it in the first part. First part. You'll find it in the first part. Okay. First part. That's very clear. So 7 students. Very good. So there goes the question. What type of tube should you use? Means insert. You're using means starting from insert. First you insert, then you check, then you feed. All these 3 are using from the beginning to the ending. Beginning is inserting, medial is checking, and final is using. Feeding. Inserting plus checking plus feeding is equal to using. The beginning of using is inserting. The middle part of using is checking. The final part of using is feeding. Okay. Input, you are inserting. Confirming, checking. Feeding, practicals. That is, you cross the second line. Yes. Now, let me now see the students. Jebin is there, my regular student. Smita is there, regular student. Elizabeth is there, regular student. Sinimol Augustine, regular student. Rajya Lakshmi, regular student. Juliet, guest. Sinimol Chakko, guest. Smita Kanta, regular student. Okay, so fine. So regular students. Okay. Now let me check the other side of the picture. Okay, there is Dr. Aisha is here. Wow. Hello, Dr. Aisha. Okay. Okay, you don't have a mic. You're watching from the computer, I think. So fine. And Sarah. Sarah, switch off your video. Don't open your video. Stop video. Not necessary. Stop video. Why the video is not stopping? Please stop your video. Yes. Yeah. There is no permission to open mic only. So never open the video, please. Fine. Until you are asked. Fine. So is there any permissions for not opening the video? Muting is there. Somewhere it might be. Okay, fine. Next. Now we are going to the third level. We came deep, we came deeper. Now we are going to the deepest. So next, here it is. Type we already know. What do we know? Now next one is, so this takes you to the question, text, and this takes you to the part of the text. And the next one, oh, I have already marked it, so no problem. Okay. So now let us see. Period and extended period. Period and extended period. Extended. So now I'm going to give you some options here. Now think about the alternative words for extended. Come on, hit the button. Synonyms, synonyms, and synonyms. Type all the synonyms in the world you can think of extended. Write down the synonyms for extended, the word extended, please. Yes. Extended. Synonyms. What? Prolonged. Very good, Juliet. I was thinking whether anybody will write that word. You have taken the word out of my mouth. Prolonged. Then long, prolong. What are the other words for period? Period. Yes. Prolong, lengthy, very good. Enlarge. Enlarge is area. Okay. Enlarge is area. Okay. Expand. Yeah. Okay. Synonyms are synonyms. I did not. Enlarge is also okay, but it's a synonym. Yeah. Period means time. Very good, Cinnamon. What about the other words? A word which starts with a D. A word which starts with D and ends with N. Starts with a D and ends with N. Period. You know this word, I know that. Starts with a D and ends with N. Nobody? Okay. Starts with a D and ends with N. Period, phase, okay. D and N. Okay, the second word is yes, Rajya Lakshmi. You are very excellent. It doesn't mean that others are not excellent. It doesn't mean that you are always excellent, because last time you wrote common sense spelling mistake. I remember. Okay, I'll be noticing each and every student, everything, because I am a teacher trainer. Okay. So now you have given, you are very excellent. But sometimes you prove that you are very ordinary. Last time you wrote common sense, there you made a spelling mistake. If you want to go and check it back, you can check. You could have seen and you could have written from the question, my question, elongated. Yes. Duration, very good. Even wise people can do foolish mistakes. That is what I am going to tell. Okay. Every wise person is sometimes foolish, and every foolish person is sometimes wise. Okay. But don't be wisely foolish and foolishly wise. Okay. Every wise person will be foolish sometimes, and every foolish person will be wise sometimes. Because even a fool will not throw stones at you until you disturb him. That means he is wise all the other time. And he knows at whom he has to throw stones. He is a fool, but still he knows at whom he has to hurl the stone. H-U-R-L, hurl. So don't think that foolish people are not wise. Foolish people are equally wise. Okay? Because they know only when you disturb them, they'll throw stones at you. Right, extended period. Very good. Now what we are going to do is, okay. What we are going to do is, we are going to, okay, fine. I have to take this one only. Yes, this one. Okay, let me copy, print the screen, because both of them I have to show you there. Okay, Control V. Fine. That is one. Now what I'm going to show you is, okay. I have to take you there. Here, first part. Yeah. Now there you can find the answer. I asked you to give the synonyms of the word period. Another synonym you will get. You did not even think about it. Okay. Now you get the answer. Come on. Type your answer in the chat box. 7, 6. What type should be used? Type. Okay. 6. Think about the answer. What answer will come? What type of tube should you use for patients who need nasogastric feeding for an extended period? Both the words, extended will not be there, period will not be there. Some other word will be there. Both, two different words will be there. Don't expect the words to be same. If you expect the words to be same, that means you are foolish. Okay. Fine. So, you have to use only 2 words. 2 words. 5, 4, 3, 2, 1, and submit your answer. Come on first. Yes. So, right. So that is the answer. So the words are, what are the words there which we have seen? The synonyms are very, very important, I told you. So now you are learning. Okay. The synonyms are what type? Okay. Extended period. Extended means long term. Okay. Extended means long. Sorry, extended means long. Then period means, sorry, period means term. And you will be, many people will be searching for they don't know they see where is extended, period, where is extended, where is period? Nowhere. So that is confusion. If you know these words, automatically you can identify. So now this is the next question. This is the next question. In which text can you find information about? In which text can you find information about? So this is like 1 to 7 questions only. We are doing everything. I think you are able to understand. Okay, let me ask you this question. So, first step, that is skimming. First step is skimming, is common for all the 20 questions. Without doing that, you cannot go to any question. If you don't do skimming, for 1 to 7 questions, how you are doing like that, you will not do, then you are going to waste the time in remaining sections. That's it. So you have to remember that. What should you apply to a feeding tube to make it easier to insert? So simple as that, so simple as that, so simple as that. Where do you find this information? What should you apply to a feeding tube to make it easier to insert? So before or during or after? Inserting or checking or feeding? So easy as it appears. Now question number 9 starts. Question number 9 starts. Yeah. Come on. Type A or B or C or D. Before inserting, checking, feeding. Before explanation. Before checking, feeding, inserting, explanation. During explanation, inserting, checking, feeding. Ing means gerunds. Or after inserting, after checking, after feeding. After feeding means after feeding only. Before inserting means it is before checking and before feeding. After feeding means after checking and after inserting. But before Feeding and after inserting means checking. So you have to understand this. 9 students have written very good. Now people have become very serious. I was thinking 10th question, I'll remove some people who are not participating. Okay, fine, that's good. Dr. Murtada need not participate because she's already passed her exam. Dr. Murtada, I want to ask you one question. You are going to help my students because you know what? You are very happy because you have cleared. I'm opening your mic. How can you speak? How can you speak? How can you speak? I want you to speak. Okay, if you cannot speak, okay, you cannot do your phone and speak. Otherwise, you just type. If you can speak, you can speak. I don't know how you can. You have to keep your headphones or something. Otherwise, you can just type here. I'm going to ask you 2 questions. Okay. Aisha Murtada, after going for exam, after doing the exam, and before getting her result, she asked me one question. She told me, where is that? Yeah, she asked me one question. Okay, yes. Aisha Murtada, she has sent her result. Thank you, Aisha. Thank you. Yeah. This is the result of Aisha. This is the result of Dr. Aisha. Yes, Aisha, at least your name, okay? First name, at least something. Okay, fine, no problem. Okay, fine. Right, no worries. Okay, this is her result. Speaking 400 and reading 390. Not 380, it is 390. 390 and listening 360 and writing 350. So she got writing 350. A doctor who has got 400 in speaking has got only 350 in writing. That means you can understand. Okay. The worst area is writing and reading. Okay. So now you have to understand this one. Okay. Now this is her results. Fine. So this is Aisha Murtada, Dr. Aisha. Thank you, Aisha, for submitting your result. Okay. Thank you, Aisha, for submitting your result. And then okay. Next one is fine. Okay, fine. So she is joining as, okay. She asked me, sir, I want to do something for you, for your students. So I said, okay, I'll give you something. So she said, today she asked. Then I told, yes, you can definitely support now. Yeah. So she will be taking some speaking sessions. She's good in pronunciation. She is in the United Kingdom and she will be taking some speaking sessions, not for everyone. Not for everyone. Selective students, those who come before me for feedback. So she will be taking the speaking sessions for some students who are dead serious. Who are dead serious. That's it. Okay. So if anybody is interested to have some sessions, because I'm recruiting special people and I'm going to give them special training. So even, okay, the people who are my interlocutors are trained by me. Okay, I will train them how to ask questions also, not just like that. I will train them. I'm a teacher trainer. I'm a master's in education. I taught hundreds of teachers. I'm a teacher trainer. I teach teachers how to teach English. I teach them methodologies, English methodology, methods of teaching, we call them. Okay, psychological foundations of teaching, philosophical foundations of teaching. Okay, subject, everything. Fine. So they will definitely help you. Thank you, Aisha, for your support. You wanted to do something, definitely you are there with us. And I will give you more than what you expected. Okay, fine. Yes. Now, question number 9. What should you apply to a feeding tube to make it easier to insert? To insert. Okay. To insert. So which is important here? Which is important? Which is important? Think about this one now. Yes. So now, A, explanation. So this one, what should you apply? Apply before explanation, or apply before inserting, or apply before checking, or apply before feeding, so that it is easier to insert. Before explanation, or before insert, or before checking, or before feeding, to insert. Or during explanation, or during inserting, or during checking, or during feeding. Yes. Let me know. So now, question number 9. Type your answer. A. Yes, you have all written already. Very good. So the answer is B. Unanimous. Unanimous. Unidirectional. Very good. It's absolutely good. That means you are becoming experts in realizing things. In the exam, you will finish it in each question in half a minute, 30 seconds each question. 20 questions, 30 seconds each. That means in 10 minutes, you'll finish and you'll get 400 above. And you'll finish it in 7.5 minutes. You'll get 450 marks. And you finish them, all these questions, in 5 to 6 minutes, you will get 500 marks. That's it. Fine. Next. Now, okay, that's done. So now here the point is easier to insert. To insert means before inserting. Okay. Where am I going? Sorry. जाने को दे टी बैठना ना जाने हाँ टी लिया हाँ चिन्ह बैठ पेद्दा करवा को चिन्ह लिया okay now see here okay now see here to insert means to do, that means you did not do or you are not doing. To do is before doing. Okay, to is pre means before. To insert is nothing but inserting. Okay, that will come in the inserting category. To check means before checking and after inserting. To feed means before feeding and after checking. That is so easy. Okay, what do you do to feed? That is comes before feeding. Okay, so after inserting, after checking, after feeding, or while inserting, while checking, or while feeding. Easier to insert, before inserting only you will do. You will apply something before inserting. So where will you get? In the inserting category. So easier. To insert means before. To do something, that means you did not do it or you are not doing it. You want to do it. It's to infinitive, means incomplete action. Incomplete. To do, to insert, means to infinitive. To infinitive means incomplete action. I want to go home. Did I go? No. I want to go home. It is incomplete action. It is incomplete action. Okay. It is incomplete action. So it shows that it is incomplete. Inserting is not complete. Then how can you check and how can you feed? So checking is gone, feeding is gone. So it is to insert, means inserting is not complete. So you will apply before inserting. And you will apply something to the feeding tube. What should you apply? Okay, that's very clear. Okay, now let us see this. So this is the first stage. This is, okay, scanning stage, to insert. Okay, apply is already there. Okay, to insert. This is the skimming stage. Sorry, skimming stage. Skimming stage means the main word. To insert means present, past, future. This is present. Means not yet inserted and you are now about to insert. So before inserting, that's it. Print the screen. Question number 9. Okay. Now having done this, now let us see the next one. Having done this, let us see the next one. What should you apply? So apply. So application. So you have to apply. You have to put, you have to add, you have to pour, or you have to do something to that. What should you apply? Should you apply what? Some powder or some jelly or some grease or something. Something you should apply. So apply is the operative word. Apply is the operative. You have to apply something. Apply, application. Okay, apply, application. Okay, pour, rub. Okay, add, Something like that. So these words, a verb is important now. And there you see what is the word apply. Write down the synonyms of apply. Come on. Come on. 30 seconds. 30 seconds. What are the synonyms of apply? What are the synonyms of apply? So application, like that. What are the synonyms of apply? Come on, write down. Bohloko, lineo bohloko. Right. What should you apply? Put in, very good. Think about whatever, even if you feel that it is nonsense, but still you can put, no problem, whatever. Think and write something. Start thinking first. Let it be mistake, no problem. At least you start thinking. Okay. Rub, application, adding, pouring, sprinkling, pasting. Very good. Pasting, cinnamon, very good. Put in, pasting, rubbing. So you can use whatever words. So these are the words which you have to take. Now let us see the second question there. Okay. Yeah, administer. Okay. Right. Now let us see here. Question number 9. Okay. Now, here we have this one. Okay. Yes. Now here we are changing this one. In which text can you find the information is gone? Then easier to insert. Easier to insert. The same points. Is it in what to insert or is it in how to insert the procedure? Now this is the point. So now what should you apply to a feeding tube? Is it related to what to insert or is it related to how to insert? So the second point of question. So in which year you have to write 1 or 2. Come on, 1 or 2. Type 1 or 2. What to insert or how to insert. So what you should apply to the feeding tube. Feeding tube is already what to insert type maybe or how to insert procedure maybe. Which is one? You think like that. What should you apply is related to type of tube that you have to insert and how the procedure that you are going to insert. So what should you apply is related to which question? 1 or question 2? Okay, very good. Majority of the students have said 2. Okay, now let us take that one, 2. That means you have to go to the second slide. You have to go to the second slide. Okay, hide floating mating controls. So now let us see here. The question is differing now. The question is differing now. Earlier it was what to insert. Earlier it was what to insert. What is related to type. But apply related to how method. Application of something is a part of a method. Okay. So that is it. So now this is the operating word. I told you already. New word. What should you apply is important. Apply what? Not what type of tube. What type of tube? No. This is what should you apply to the tube. Already first one is gone. Okay. Apply. What should you apply? Is going to the point number 2. Very good. You have given the right choice. Fine. So learning the step-by-step procedure is very important. Patience is a virtue. Not everyone. There are people who think I have paid so much, so he has to do according to my wishes. Okay. There are some people who think you are my father, so whatever I want, you have to give me. No. Whatever the father wants, he will give you because he knows the best. But there are some children who says, why did you give birth to me if you cannot give what I want? Huh? So there are some people like this. They don't know, okay, how much your father loves. Okay, they want to tell the teacher how to teach them. Some students are there who direct the teachers how to, teacher, don't teach me all these things, just in 15 minutes explain me simply, because I am busy teacher. I don't have time teacher. I am doing 12 hours duty teacher. And I cannot spend that much time. I just want to pass. Why should I need all these things? Am I becoming an English teacher? But remember, you are playing with the lives of the people. If your English is not right, and you will be writing letters, and you will be miscommunicating the information to the relevant medical professionals, and you will make a nonsense out of everything. Because English is language, and language is a medium of communication. If you speak improper English, your communication is wrong, and you'll miscommunicate or give wrong information, and everything goes wrong, and you will be the responsible person. Okay, be careful. Be careful. You go to the doctor. For example, I am a patient, and I go to the doctor. Doctor, I have headache, but don't give me medicine. Give me some injection. Because, don't give me injection. Give me only medicine. And if they give medicine, you don't take. So that's why giving injection in their presence is better. It is no, I'll not give you medication. I'll give you injection. Okay. Don't direct the doctor, okay, what he should prescribe. There are some students, very great students, who teach me how to teach them. They are even bigger than Cambridge University for me, because Cambridge University has certified me as a teacher. 3 universities have certified me as a teacher. One for B.Ed, Kakatiya University with a university rank, Annamalai University as a teacher trainer. In Indian, both are Indian universities, and Cambridge University as a recognized international certificate. Even Indian certificates are working abroad. Okay, they are working as teachers in many countries with Indian qualification, B.Ed and M.Ed. And these people are now teaching me new things, how I should teach them, great things. I feel I should not take, but after taking, I feel sad. Okay, I feel literally very sad. And they don't learn, and they fail in the exam, and they come and say, I went to Simonson, but still it's a shame for me. Better being ashamed of such people, better not to take them at all. I least bother. Who is asking you to come and join with me first place? If you want to succeed excellently, then come. Give me your time. So this is the, sorry, print screen. That is it. So it is going to the second part. Now we are moving to the second part. And this always goes in a sequence, almost always. So it will go to the second text B, second part. Yes, B2. We are going to B2. This is B2. This one lecture is enough for you. This one lecture is enough for you. This is ultimate. So clear all drawings. There you are. So here it is. What should you apply before inserting? To insert. There it is. You identify the answer. I am leaving the screen for you. Okay. That is the question, information related. So find out what should you apply before inserting or to insert. To insert means before inserting. To make it easy to insert. To easily insert. To make it easy insert. To before inserting. The question is there. The answer is there. What should you apply? Okay. It is not one word. It is a phrase. A phrase. A phrase. You have to write a phrase. What should you apply? Same word will not be there. Apply word will not be there. Some other word will be there. Yes, type your answer. 5. Okay, 1 second. And okay, already I have given you the question number 9. Okay, fine. Question number 9 already given. Yes. So type the answer and keep it ready. 5, 4, 3, 2, 1, and submit. Elizabeth, I'll check whether anybody has written right. Till now, 3 people have written, but 3 people have written wrong. 4 people have written wrong. 4 people have written wrong. See, something is missing. Something is missing. Something is missing. Something is missing. Not something. 2 things are missing. Actually. Two things are missing. Try again. Try again. It is only 75 to 80% right. Yes, somebody has written. Elizabeth has written right now. Still not right. Still not right. Unnecessary space is there. Unnecessary space is there after the hyphen. First is right, second is right, third is right, fourth is right. Fifth is also right, but sixth is wrong. Lineo, bohloko, that's wrong. Yes, the last one, Jebin, is perfectly right. Article with a capital letter or not a capital letter, no problem. Water-based hyphen, but before a hyphen, after a hyphen, you will not use any space. Yeah, Smita, hyphen, space is there, no need space. Okay. then it will be 100% correct. This is 99.99% correct. Still mistake is there. So before and after hyphen, you will not leave space. Somebody else will give you a mark, but I will not give you because it's punctuation mistake. Compound noun with a hyphen. Yes, all of you type properly so that you will learn at least. Learn as it is. See, as it is. Water, no space, hyphen, no space, based, lubricant. Water based is a one word. Okay. Lineo bohloco, no space after hyphen. See the one above you and write like that only. Okay. Right. Space is not required. This is punctuation rule. If you write like this in the exam, again, there also problem is there, punctuation mistake. Okay. Full time, hyphen. If you write like this, the same thing you'll write there also. So you have to be careful. Very good. Fine. So now, so here we'll go. Okay. Yes. Okay. Today, one girl from Amritsar, where I have an institute, she called me and she told me, sir, I got visa. I'm not, I got visa. And she was very happy. 2 years back, before lockdown, she applied for visa. She got, okay, excellent results in IELTS. She is my student. She was my student. Okay, she was my student. She said, sir, I got my result. I will give you a gift, sir. I said, what do you want to give gift? Just this is enough. This is a bigger. No, sir. I never thought that I could do it, but still you taught me. Middle of the night, you taught me. You taught me alone. I said, because you deserve it. People are ready to pay me thousands and thousands of rupees, but you need it. You respect the quality more than thinking about money. So she used to listen to me 100%. Her name is, what's her name? Kaur, which Kaur? Just now she talked to me. Yeah, here is the WhatsApp. Jeevan Kaur, yeah. Jeevan Kaur, thank you, sir. Okay, so this is the visa. I am not going to show that. Okay, so here you can see dedicating to my. I said delete it now. You don't want to give me. I don't want to show you. So she said, thank you, sir. Dedicated to my loving sir. I said, you can delete this photo now. Okay, so like that. So people are there. She's going now. She said, I'll give to you a laptop, sir, she said. I said, all those things I don't need. But her mother, when she passed them, okay, she told, you told that you will give sir laptop, no? Give him. Then she called me and said, sir, my mother is telling you me to say, she's reminding me, sir, telling me when I passed and I told her, she immediately told like this, sir, you promise that you will give laptop to sir. Okay. And then I told her, I don't want your laptop now. If you want to send also, don't send me. I don't want. I want to say that it is come from Canada. You go to Canada, settle there, then from your earning there, then when you come back, you bring laptop for me. Today she talked to me for 15 minutes before this lecture. She was very happy. And she talked on video, WhatsApp video call, and her mother was very happy. Very happy. She was telling in Punjabi, Dhanyawad, Dhanyawad. Okay. Her life is settled, she says. So that's it. Parents are happy. Yesterday, one girl, Divya D'Souza, I asked her, Divya, I'm calling you at 12:30 or 1 o'clock. Are you comfortable? Tell your rubber band, I told. She did not understand what. Tell your husband, I told. Is he upset or angry with me because I'm disturbing you? Because of me, maybe you are delayed sleep and other things. No, sir, my family full, they are fans of you, sir. I was very happy. That makes us proud, We live through our students, teachers. Engineers live through bridges. Okay. Teachers live through students. So that's what it is. I was very happy. So that's what makes us proud. Okay, fine. Right. So now you see water-based lubricant. Okay. So this is the question. You don't need to listen to 10 different sessions. Today's session is a workshop, I told you. I'm going to discuss many different things. So that is the question. And you have to write like this. A water-based, one word, lubricant. Lubricant. That's it. Okay. So that is the answer. Very good. Rajya Lakshmi, W should not be capital letter, small letter and hyphen is missing. Okay, fine. Now 10th question. See how many steps are going on. 1, 2, 3, and 4. 3 steps. This is skimming stage. This is scanning stage. And this is solving stage. 3 steps. I told you, right? But it will be very easy if you follow these steps. So question number 10. Where is the passage now? Books. Yeah. Question number 10. Yes. So what should you use to keep the tube in place temporarily? What should you use to keep the tube in place temporarily? Okay. Here, sorry. Sorry. Why I took this one? Okay. Should have copied these things. Okay, there you go. What should you use to keep the tube in place temporarily? Yeah. In which text can you find information about what should you use? Okay. In which text can you find information about what should you use to keep the tube? What should you use to keep the tube in place temporarily? In place temporarily. So is it before explanation or before inserting or before checking or before feeding? Or during explanation, during inserting, during checking, and during feeding? Or after explanation, after inserting, after checking, after feeding? If you ask these questions only, you'll get this answer. Think about that. And question number 10. I'm going to submit question number 10 here. Submit question number 10. Yes. Now let us see there. Yes. Now 5, submit your answer. Type and keep it ready. 5, 4, 3, 2, 1, and submit. Janet even now. Okay, very good. You have written your answers. Okay, now if you see very carefully here, the point is obvious, clear. What should you use? What should you use? Okay. What should you use to keep that tube in place so that it will not move here and there? In place means strong, stiff. Okay. Stiff, temporarily. Okay. Stiff temporarily. Okay. Temporarily you have to put something. Okay. What should you put? But we are not bothered about this one. Okay. We are not bothered about this one. So here the first question is which part you will find. We have seen already. Okay, you have written already. To keep the tube, to keep it, you will keep it in place temporarily. Okay, temporarily, not permanently, for a long time, temporarily. So once you find it perfect, you will make it perfect. But till then, what you have to do? Okay, till then, what you have to do? That is it. Right? So, now where you will find this information? Is it, okay, before, during, or after explanation, or inserting, or checking, or feeding? Okay. Temporarily, not permanently. Temporarily here, not permanently. Until you remove, that is it. Not forever. Permanently doesn't mean forever. Permanently means until the purpose is served. Until you replace it. That is the meaning. Okay. So till when? Once it is confirmed, then you will make some arrangements, final arrangements. But here, temporary placement. When will you do temporary placement? Before explanation, before inserting, before checking, or before feeding? Temporary placement during explanation, during inserting, during checking, or during feeding. Okay. Or temporary placement after explanation, after inserting, after checking, after feeding. Okay. When will it happen? Where exactly? Okay. So when exactly? Right. Is it before inserting, or after inserting and before checking, or after checking and before feeding? When exactly? Think about like that. There you will get the clues. So to keep is to place, that is in place. To keep in place means to make it firm. You'll insert and make it firm, or what? You'll check and make it firm, or you'll feed and make it firm. Right. Is it during inserting stage, or during checking stage, or during feeding stage? Okay, remember that. So this is how you, because these are procedure style of questions. But these applications go everywhere. Not only for this, everywhere, every text A. Okay. That's it. Every text A. That's it. So next. Yeah, drawing. Okay. Okay. So here, now in question 2, 10. Okay, let me see how many people have written what. Thank you so much, sir, for allowing me to attend your class. It's my first time, but I learned a lot from your class. Hope to attend again. Good night, sir. Morning duty for me. So I'm leaving. Okay, good night. Okay, now let us see here. Question number 10. In which text can you find information about what should you use to keep the tape in place temporarily? Okay. Now here there are, once you saw that it is in, 1 second, which part you told? B. Okay. You have said in B. Okay. Now again in B. Okay. Again in B. So I have already marked. Yeah. So I have placed it again for you. So now, not here. Yeah. Now, yes, now, is it in what to insert or how to insert again? Is it what to insert or how to insert? So now here again 2 questions are coming. It is in first part, first half or second half. Means the type of tube or the method of inserting the tube. Okay. The current is out, so I have to connect my. Okay, it's already mine only connected. Okay, no problem. Okay, now you have time 10 seconds. Type and keep it ready. I'll count from 5. You have to write only one answer, 1 or 2. 1 means first part of B text. 2 means the second part of B text. Okay, 5, 4, 3, 2, 1, and submit. Follow my instructions. Don't submit very fast. Let everyone together do it. That's the reason why I give counting, so that everyone will be ready and together you do it. Okay. So, now, so you'll go in second part. Many people think that I will watch from the YouTube. But if you watch in the YouTube, you will not get all these things together. Okay. You are watching a movie like that. That's it, not the real action. Fine. So what to insert or how to insert? What should you use to keep the tube in place? Already placed means already inserted. After inserting, this is. But before checking. After inserting, but before checking is inserting stage only. After inserting, but before checking, checking did not start. So after inserting, before checking. So it is after inserting. So there only. So B. In B, what to insert? Tube is already inserted. So what to insert is not questioned there. Okay. And how to insert and keep it there. That's it. Already inserted. So how to keep it there? But before checking, okay, you have to use something. You have to use something. So it goes to the second part, print screen. Yeah. Right. Fine. Thank you. So what should you use to keep the tube in place temporarily? There is no electricity here now. Okay. I don't know when my laptop will go off. I don't know if it continues. Okay. Right. Our failure, our shortage. So, fine. So, you can see it clearly there. Next. So, only 4 students have written. Lineo Bahloko, Smita, Elizabeth Rajalakshmi. What about others? There are 4 more. Okay. Right. Next. Okay. Okay. Right. That we'll see later. So here it is. Now, okay, here's the point. Now, in which text can you find information about what you should use? Okay, we have decided that it is part B or text B. And in the text B, it is in the second part. Not what to insert, but how to insert. Oh. Sorry. Yes, this one. Print screen. Yes. Yes. Okay. Now, next we are going into the text. Text A, B2. Okay. So there it is. B2. Okay, I have to remove this also. No? Okay. Clear all drawings. Okay. Here you are. Hide floating. Yes, here you are. You can check it now. 1 second. I'll post this here. Yeah. So now it is. Yes, you can find out the answer. Now what you have to do is, I'm counting 7 onwards. Okay. It is one word. One word. One word. 7, 6, 5, 4, 3, 2, and 1. All of you submit, please. Then I will tell you which answer is right. Okay. So 3 students have given. What about the rest? Okay. Now we are going there. Yes, 7 answers. Very good. 7 people, and 2 are my screens. Very good. 1, 2, 3, 4, 5 have written. Okay. No problem. Okay. Yes, now let us see here. Last question. Okay. Here, the answer. Sure. Electricity is not there. Yeah. So that is the answer. Very good. That is very good. Linio Bohloko from Lesotho, Lesotho, Africa. Hello, Bohloko. Can you unmute?
Hello.
Hello, Bohloko. This is your first session with me or second one?
The first one.
Yes, first one. Are you able to find the importance of quality, or you think that this is waste of your time?
I think I will be able to answer after the second attempt because I was late. I didn't notice the time in time. So
Okay.
it's like our time is not on the same. I have to recheck.
Okay, fine. So do you feel that the sessions are worthy enough for you?
Yes, especially this one of reading. I'm very poor on reading.
Okay. Don't say I am poor, say I am good, but I want to be the best. No negative.
I'm good, but I want to be the best.
No negative. No negative.
Okay.
Okay. No negative. So negative words will pull you down. So be positive is my blood group. What is your blood group, Loco?
Oh, positive.
Okay, you are also positive. Oh, positive. Very good. So why are you using negative words? Oh, electricity. I'm talking to you and power has come back.
Thank
Power
you.
is restored. Thank you. Okay. Fine. So Aisha, I don't know, your mic is not there, so I cannot make you talk. So do you think that these are, if you attend such sessions, you did not have much time, so you attended whatever possible. If you attend full session like this, don't you think you will get 400 and 450? That's what I was asking. Already you got 380, 390. So you will definitely get 450 or something. Agreed or no? Aisha Murtada. You can type whatever you want to feel. Okay, so this is the 10th question. So here you are. So tape, one word. Don't write a tape or an tape. What is there that you write, that's all. Okay, in the question it is not given anything else in the passage. So write how it is, that's all. Okay. Next. Actually, I missed something. Okay. So right, we have come to the last. Okay. Set. Okay. Yes, we are going to stay. Okay. Now, we have learned the things. Okay. I want to finish this. So we are going to continue a little more. Okay, let me see who are there. Okay. So Elizabeth, Jebin, Linio, Rajalakshmi, Sinimol, Smita, Aisha, and Grandmaster and Peter. So 7 students are there other than Peter, Simon, and Grandmaster class. Okay, fine. So next question. Now I am giving you a question. One question I'll give you. Just answer in one word. This is a yes, no question. This is the question. Answer yes or no. I'll check that there are 7 students on board. Maximum vote. If others, everyone, who more than half says, okay, today we'll continue. Yes, we'll continue. If so, out of 7, 4 students should say one side. Okay. Yes or no, your wish, be free. Three yeses. If you don't say anything, I'll consider it as no only. So 4 more are left. So either you write yes or no. Yes, sir, and your convenience as well. So yes is 4. Okay, this is okay. This is 50-50. I'm there till tomorrow morning also. If you want me to sit, I'll sit. That's not a problem for me. So I want a yes or no. That's okay. Yes, 4 over, finished. So Elizabeth, Linio, Smita, and Sinimol, 4 students said yes. So we are moving forward. That's good. Okay. Even if everyone else say no and only one student says yes, I will still continue. Okay, but I just wanted to take your concern. So 10. Right, 11. Huh. Very easy, dead easy. If you follow this type. Okay, you just follow this type. It is very easy. Yes. So there you are. Yes. Here it is. In which text can you find information about what equipment should you use initially to aspirate a feeding tube? What is the key word? Okay. What equipment should you use? Initial equipment should you use initially to aspirate a feeding tube? Initially to aspirate a feeding tube. Initially. Remember that. Okay. So the word here is, yeah, find out. Type of please. Question number 11. What is the word which will help you to go to A or B or C or D? A is explanation, B is inserting, C is checking, D is feeding. 11th question. 11th question. Okay. I'm not asking which word in the question. I'm not asking explanation part A, part B, part C, part D. I'm not asking. I'm not asking that one. Hold on. I'm asking you, find out the keywords and the operating word. Which is the operating word? We want, the question is, what is the name of the equipment? This is very important for here. So this is it. What equipment should you use initially, means in the beginning, to want to aspirate, in order to aspirate? So which key word, you tell me, which keyword will take you to the correct part? Okay. Come on. I'm giving you, say, okay, no problem. 15 seconds I'm giving you. Come on, think about that. Smita, aspirate. Okay. Equipment, somebody has written. Come on, come on, come on. Equipment to use to aspirate. I want only one word, please. One word. One word, not many words. Only one word. One word only. Yes. So we got it now. So 7 students have written. Bohlo ko aspirate, Smita Kanta aspirate, Elizabeth to aspirate, two words. So one word only. Okay, fine. So that's it. So let us consider this word aspirate. Okay. So this is the word aspirate. So aspirate. Where did you find the word aspirate? Now you have to write. I'm taking you to another. Scanning is over now. Skimming, scanning. Okay, aspirate. Aspirate, where did you find? In A, that is explanation, or B, means inserting, C, checking, D, feeding. Where did you find now? Now I'm giving you 10 seconds. Write A or B or C or D. Okay, so finished. Very good. Now let me see how many have given. So 5 students. So see, it is unanimous. That means you are growing very wise now. Okay, C. Height floating. Okay, we got it. C, that is okay. Checking. So what equipment should you use initially to aspirate a feeding tube? Okay. So you are using it for checking. Okay, let us take that one. Checking. Now, so we are going to C. And C, first half or second half? How do you know that it is going to first half or second half? Okay, now don't write anything. I'm going to change the slide. Okay. I'm going to change the slide. Okay. Don't do anything now. Okay. Because what we are going to do is very important. We know that we are going to C. But in C, where exactly we are going? Okay. Now in C, where exactly we are going? You know, we have broken it into 2 parts. Okay. The first half, sorry. The first half or the second half. Where exactly are we going? The first half or the second half? Yeah. Now your choice. I'm giving you exactly 5 seconds. I'm giving you exactly 5 seconds. And in these 5 seconds, you have to type and keep your answer ready. And when I count, yeah, 5, you have to write only 1 or 2. 4, 3, 2, 1, and submit. You have to type only 1 or 2, any one number. Don't write full, write 1 or 2. That's enough, I told no. Okay. So, fine. Write down. First half means 1. Second half means 2. That's all. Right. Okay, now let us see what majority of students have written. So 1, 1, 1, 1, the first half. 5 students have written 1. Elizabeth, just follow the instruction, 1 or 2. Why do you want to write too much? The participation is important, but no need to, okay, unnecessary pain you need not take. That's what I am doing now, unnecessarily reading everything like that. Okay, fine. So there it is. Okay, sir, thank you. That is what I like. There are people are of 2 types. One is, yes, boss, I am the boss here. I am the commander. I am the military commander, you are my soldiers. And soldiers are of 2 types. Those who say, yes, boss, and those who say, why, boss? Boss is always boss. Okay. Those who say, yes, boss, will save your time. Those who say, why, boss, will get them difficult times. Because the boss will never explain you everything. He will explain you what to do, but he will not explain you why to do. Because he says, just listen to me. That's it. Don't ask me why. Do it and bring me. That's all. I am the boss. You know that pretty well. You made me boss. You selected me to be the boss. So don't try to boss me. Saying, do like this, do like this, do like this. Just to say, yes, boss, and do. That's what I liked in cinema now. Immediately she said, yes, sir. These people who say, yes, boss, will save your time and my time also. Because I have no time to explain my 30 years of experience to you in just 10 minutes. So Just listen. Everything is cooking. Mother cooks and puts it on your table. He cooked for 1 hour. Don't ask her how you cooked. Just eat it in 5 minutes or maximum 10 minutes and go off. Don't ask her how you cooked. You will never eat. Okay, you will not even start your food only. Okay, just eat and go off. That's what it is. Okay, that's really nice. So, the first half, that's it. Right. Now we are going to the first half. Okay. Now what I'll do is I'll clear all drawings. Okay. Now I am taking you to text C. This is second half. He told, okay, how did you know that it is in the first half? I did not, sorry. I made a mistake. I made a mistake. I did not tell you. How do you find that one? What is the word I wanted to ask you? Okay, let me ask you here. Not here. Here only I should ask. This question is like this. So aspirate is taking you to C, but to first half or second half, how are you going? Which is the word that is telling you that you have to go to first half? One word will be there. What is that one word? Come on, type. How did you realize that it is first half? Type one word. Come on. Very good, Elizabeth. Very good. Come on, what about others? Okay. This is the word. Okay. Initially. This is the word. Okay. Which is taking you to the first half. You have to realize that. Initially means first half, not second half. Finally means the second half. Two halves are only there. So this is how you have to identify. Oh, I marked here. Okay. Yeah. So we got that one. Very good. That is initially. So this is how you will go step by step. So next one. And now we are going to the text. Yes, C1 is here. Okay. Yes, now see there. This is C2. This is C1. Yeah. Aspirate obtained. So before that one. To aspirate is before aspirate obtained. So initially you see there. Where is initially? 4 quarters. First quarter, second quarter, third quarter, fourth quarter. Initially will be in the beginning only. So see there. And it is a phrase of 2 words. It is a phrase of 2 words. Okay? 2 words. A phrase of 2 words. Type your answer and keep it ready. Type your answer and keep it ready. Yeah. There you are. Now, 5, 4, 3, 2, 1, submit. Submit, all of you. Then I'll tell you which is the right answer. Okay, you still did not check. Okay, fine. I'll keep it there still until everyone submits. Okay, I'm giving you another 30 seconds or 15 seconds. Come on, type. Two people have written, Elizabeth, Jebin. What about the others? Okay, you have to see the screen also, no? Yeah. Yes, that's it. So you have written the answer. Now, yes, this is the answer. So, a syringe. A syringe. Okay. Right. Okay, what equipment should you use? Now the word is equipment. So this is it. This is the third level. Okay. This is the third level. Right. So you got the answer there. Screen. Yes. And the answer is a syringe. Yeah. Right. Now we have gained momentum, acceleration, speed, velocity. Momentum, acceleration, speed, velocity. So we are getting fast now. Very good. Very good. Fine. The heat is mounting. Fine. Yeah. Very good. Excellent. Excellent. You are darling students. So now we are going to the 12th question. We are speeding up. We are speeding up. Oh, where is this? Okay, correct. 11th one. Now 12th one. Okay, question number 12. Okay. Copy. Okay. Okay, question number 12. We are going very fast now because you already understood everything. So if initial aspiration of the feeding tube is unsuccessful, if initial aspiration of the feeding tube is unsuccessful, if unsuccessful, if is the condition here. So this is the condition, if, danger signal, if unsuccessful. Initial we already know, initially, remember the word initial again. So this will always be there in every question, this type of, in every reading, okay. One time there will be at least initial ones or final, something like that. If initially unsuccessful, other words are not important. If unsuccessful, how long means period should you wait before trying again? Okay, before trying again. So how long means duration, time. Okay, now where will you go? Okay, so how will you know that this is the word? This is more important word. This will take you. Now first we'll go, okay. So the word is aspiration, number 1. The word is aspiration. Be ready, type and be ready. Which A, B, C, D. Come on. Type and be ready. So 5, 4, 3, 2, 1, submit. Fast. So you will go for checking, says Elizabeth. What about others? Come on, fast. Action. I don't want to delay anything. Yes, Smita says C. Come on, fast. At least half of the students should answer. Sinimol says C. Very good. Okay. What is the word which is telling that you have to go to C? Come on, type there, fast. What is the word which is telling you to go to C? That is called operating word. Operating word to take you to C. Okay, Elizabeth says aspiration. What about others? Come on. If you agree with that, say aspiration. If you disagree with that, say unsuccessful or wait or anything, whatever you want, or initial, whatever it is. If you want to go to C, which is the word which, okay, Jovin says aspiration. One more answer. One more answer. If aspiration is correct, one more answer. Otherwise, tie. Yes, come on, fast. Okay, right. Sinimol says aspiration. Very good. So aspiration is telling you that you have to go to C. Very good. Fine. Done. Exactly. Wonderful. Okay. It is telling you to go to. So question number 12. Next one is, so in C, after going to C, there are again, okay, 1 minute. After going to C, now you have, okay, we came to C already. We are checking now. We already entered checking area. We already entered C part. Now, after going to C part, okay, you will go into the first part or second part or third part or fourth part. Come on, type and keep ready. Yes, 5, 4, 3, 2, 1. Submit. 1 or 2. Any one number you have to write. 1 or 2. So first part or second part. First part or second part. I told you, this is a high level, okay? It's not an ordinary thing I'm showing you now. Okay, come on, type 1 or 2. Type 1 or 2. 5, 4, 3, 2, 1, submit. Somebody opened video or what? Because screen is coming here. Yes, somebody showed. Cinemol, close the video, please. Because the screen is getting obstructed here. Close it. Stop video. Yeah. Okay. Because if you open, somebody opens the video, no, my screen picture will come, because nobody's screen will come on the main screen, but picture will obstruct the screen. Even my video I don't put, that is the reason why. Okay, many people here, they put their videos, but I don't want, the complete screen should be covered and there should not be any distraction. Okay, so fine, sorry, don't feel upset. Okay, next. So you have written all of you. What is that? 1. Very good. Now after going to 1, okay, we are going to 1. Fine. Okay. So how long means period. So there you will go. Waiting period. Waiting period. So you will get one number and hours or days or weeks or month or minutes or seconds. So long is period. What is the period? Seconds, minutes, hours, days, weeks, months, years. This is period. Then number, how long, how much, number, what is the number? 1 month or 2 weeks or 3 minutes or 5 hours, like that. So that you have to focus. Okay, print screen. Yeah, so that is it. So once you finish this one, now you see there. So we are going to the first half. We are going to the first half. Initially, I told. Okay. Where is that? Oh, sorry. Here. We are going to the first half. Okay. Here it is. Yeah. Fine. Yes. There is the screen. Okay. So, if it fails means which side you shall have to go, right side or left side? Fail means which side you should go, right side or left side? Come on, write down, type in the chat box, right or left? Right side you have to go or left side you have to go, right or left, any one you have to write. In this chart, you have to go right side or left side. Failed, aspirate, obtain, yes, no. So which side you have to go? Elizabeth says right. Okay, so 2 or 3 people have written, yes, Jevin says right, Sinimol says right. Okay, Smita says right. So 4 students have told right. So right side, okay. How did you know that it is right side? By what word? Because of what word you know that it is right side? Okay, you are going to right side, but what is the word which is telling that you have to go to right side? Okay. Come on, type. Activate your brains. Yeah, I'm seeing you on the screen here. Who is typing? Okay, fine. So no is the word. Yes. Elizabeth, no. Very good. One word only I want. Okay, one word only I want. No. Okay. Unsuccessful. Okay, no. Unsuccessful means no. Successful means yes. That's it. Okay, fine. So, very good. Now there should be how long? How long means period and number. Period and number. Where is period? Now this is scanning. Write down all of you. Scanning. I'm going to give you one. 1 minute. I'll give you another screen. Scanning, you have to see 5 different things. Scanning stage I told, no? Scanning, you have to see many things like this. So now we have come to a serious scanning. 10 questions are over. So even depth I am taking you. Scanning stage. So second level is called scanning stage. Okay. In the scanning stage, you have to go through these 5 things. What are those 5 things? Number one is names. Number 2 is numbers. Number 3 is new vocabulary. Number 4 is difficult vocabulary. Number 5 is special phrases. These are the 5 different things. And how do you know about these 5 different things? Now let me show you. The first one, you will know because of its what size, capital letters. Next one you will know because of its shape. Number is because of peculiar shape. And this one because of its, okay, this is capital letters. Size means height. Capital letters. Capital letters. Okay. Capital letters. Okay. Capitals. Okay, fine. That's enough. Next one. This is regarding the size. Yeah, sorry. This is also size. Vocabulary is big size. Broad letters. Size is big. Words size big. So this is it. You have to find out. So numbers are shape. You know that it's a number and period. Number and period. Number is very important. Numbers give 20% of the answers. This answer you will get only because of the number now. Okay. This answer you will get because of the number. Okay, second half I did not show you, right? Okay, I have to take you to the second half. Okay. Yeah. Okay, first half. First half. Yeah. Now you see where are numbers? Where are numbers? Top, middle, bottom. Where? Come on, write fast. Top or middle or bottom. 5, 4, 3, 2, 1. Top or middle or bottom. See the number. Where it is? Yeah, middle. Middle. Very good. Okay, middle. Now second question is left or right? Come on. Left or right? Left or right? Right. So middle right. Middle right. Okay, in the middle right, there is one big box. In that big box, okay, you will find numbers and period and the word wait. It is in first bullet point or second bullet point or third bullet point or fourth or fifth or sixth. Number of bullet point 1, 2, 3, 4, 5, 6. Which bullet point? There are 6 bullet points. Write down the number of the bullet point. Which number? 1, 2, 3, 4, 5, 6. You can count the bullet point and just type number. Yes. 5, 4, 3, 2, 1. Submit. Yeah. Elizabeth says third point. Linio says third point. So how fast you are going? How fast you are listening to my words? Jebin, this is how you are directed towards me. I am the commander. You have to follow. Smitha, very good. You are going very fast. Okay. Now, yes, you got the answer maybe there. Now, so how long you should wait? So number and period. Number may be range or minimum or maximum or from, to, between, and. Right. How long? So you have to write the numbers and the period. So now type and keep it ready. Type and keep it ready. Type and keep it ready. You will get a number. I did not ask you to post linear. So 5, 4, 3, 2, 1. Submit. Now you submit. Same as it is, you have to write. Same as it is. No problem, Linio. Bohloko, no problem. No problem. I am your loving mother, okay? I am not angry with you people. Okay? If I don't have that love and affection, I will not stay so long. Okay. So right. So you got the answer. So you can understand how the directions are. Okay, fine. This is printer screen. Where is that? Here. Yes. That is the screen. Then now we are going to the PowerPoint again. Yeah. Okay. So you all have given me the answer. And the answer is what? Okay, 15 to 30 minutes. Okay. 15 to 30 minutes. Sorry. This is the way how it is there in the text, like that only, right? Don't try your own knowledge. Don't experiment your own knowledge. Okay. Just be an obedient soldier. Then you will get the answer there in the exam. So this is the question. Okay, sorry. I have to place again. Okay, these things, control set. What happened? What happened? Oh. Here it is. Yeah. Something went wrong. Yeah, this is it. 12th question. I'm thinking what happened. Okay. How long? Wait. Long means period. How long means time. Period. Period is seconds, minutes, hours, days, weeks, months. Okay. That is period. Waiting time. And the numbers. Numbers may be range. Low, minimum this much time and maximum this much time. Sometimes both. He may give one number or he may give minimum this much to this much. Okay. So that's it. So now, how long is the key word there? So that is how you are going to do. How long should you wait before trying again? How long should you wait before trying again? There's a period, that is the duration. Okay. Yes, that is it. Print a screen. And this is the answer. 15 to 30 minutes. As it is, you have to write. Don't write like how you want to write. So that's it. So it's so clear. That is so clear. Fine. So next, 13th question. So, are you all happy with the method we are following? No problem. In the beginning, nobody used to come, but now at least so many people are there. That's enough for me. If you are yes, say yes. If it is no, say no. If it is maybe, you say maybe. I already told you, I will not teach. I'm not a people pleaser. I don't please people. I please myself. I make myself happy. Okay. If I'm happy, then I can go to bed very happily. So that's why I'll do my best. Next. Right. So 13th question. Right. Fine. 13th question. Right. Uh-huh. Okay. So 13th question. So how should you position a patient during a second attempt to obtain aspirate? So second attempt. Okay. First attempt, second attempt. Fine. How should you position a patient during a second attempt to obtain aspirate? Now in this, what is the most important word? Okay. Second attempt. So, how should you position a patient during the second attempt to obtain aspirate? Okay. Second attempt. So you understand first attempt is over. Aspirate is obtained, not obtained. Then second attempt. So how should you position? How should you position a patient during a second attempt to obtain aspirate? So you want to obtain aspirate, second position. Okay. Second position. Second attempt. So first attempt is over. Now you are going to the second attempt. Aspirate obtained, no. That means first attempt finished. Now you are starting second attempt. If it is no, from there you have to see. So now, okay. Now you tell me. So it is okay. It may be again yes or no. It may be again yes or no. So again, third time may be there. Okay. Third time, it may be there, you will do something else. Okay. Fine. Now, what is the word here, which is very important? Now, let us see. What is the word here, which is very important? Yes, type your word 5, 4, 3, 2, 1, and submit. Question number 13. What is the word which will take you to text A, B, C, D? How do you know what is the first word? The first word. Yes, one person has written position and again corrected. Aspirate. Okay. Second attempt. No. Not position, not second attempt. What is the most important word which will tell you to go to part A or part B or part C? It is again aspirate. It is again aspirate. It will take you to part C. Okay. So that is what it is. It will again take you to part C. Then again, text, okay. First half or second half? First half or second half? First half is using aspiration method. First they fail, you do something, wait for some time and take aspirate. Second time also, you fail, then some other alternative methods. Okay, that is regarding aspirate. Afterwards, non-aspirate, some manual handling. Okay, fine, let us see that. Then you will send to doctor maybe. Okay, fine. That's different thing. So, how do you know that? So this is still aspirate only. So aspirate second attempt, second aspirate attempt. So that means, is it in first part or second part? First slide or second slide? Come on, first. First slide or second slide? You are waiting 15 to 30 minutes. That you found in which slide? Okay. In that box only you will find. So it will be in the first half. Same box where you are waiting. You are waiting and positioning him. That is the second attempt only. First attempt failed. Second attempt we are waiting for 15 to 30 minutes and you are positioning him to take the second aspirate. There only. Then second aspirate. Then you will move to the next one. Okay, fine. So this is it. Second attempt for aspirate. Still in aspirate only. You are not moving forward. Okay. Right. So you'll go to first half. That's good. Right. Now I'll take you to first slide once again. Print screen. Yeah. Now let us see there. Go there. I'm taking you there. So this is okay. I have to remove this. Okay. No. Clear all drawings. Okay. Now, here it is. Yeah, this is first half. Come on, check it. Till aspirate obtained second time. See, second attempt also here only. First attempt is up first quarter. Second attempt is second quarter. That means both are in the first half only. Come on, find your answer. Find your answer. Where do you find? Left side or right side? Top or middle? Two things you have to write. Left side or right side? Left means left, right means right. Top, middle or bottom? Then next one. Third one is, okay, position. Which position? Which side? Which position you are positioned? Tea powder less. Okay. So you have written the answers. Very good. So, what about nobody has written the answers? What happened? Yeah. So, JB, thank you, sir. Why you are leaving or what? Okay. Aspirate one, second half left side. Yeah. Yes. Turn to left side. Position means turn only, na? Okay, position means turn. Position him. Okay, so that is it. That is not needed. Position is not needed. Okay. Okay. Okay, fine. Right. So here, what is the correct answer? Write down. So on left side, correct? On left side or on to left side? Just left side is not right. On left side or on to left side or turn on left side or turn on to left side. These are the right answers. Okay, fine. Okay. Yes. Okay. I did not change the number. Okay. Okay. 13. And this is 30. Yes. So that's it. And here the answer is in the question paper it is given like this. The answer sheet it is given like this. Turn means not compulsory. On compulsory. To not compulsory. Left side. That means which is in the bracket is not compulsory. Which is outside the bracket is compulsory. Remember that. If you don't write turn, it's okay. If you don't write to, it's okay. But on left side, these are very important. On and left hand side are very, very important. Okay. Right. So position. That is the word. Position is the word. So which will tell you, okay, how you have to place him. Yeah. That's it. Right. 14th question. So here there is a number. Number is very important, I told you. First number you got earlier. Now second number you are getting here, pH 5.5 exceeds. That means it may be less than 5.5 or more than 5.5. Less than 5.5 or more than 5.5. Okay. So try to understand what he's telling you there. Yeah, here it is. If aspirate exceeds pH 5.5, how do you know that this is going into the which part, A or B or C or D? Again, the same words. Take the same word, skimming first. First, you have to do skimming. One word which we have taken here, explanation, inserting, checking, or feed. Type A, B, C, or D. What is the word? First, you write what is the word which is taking. Yes. Okay, one person has written the word. What is the word? What about others? Okay. So, aspirate. So, you have to go to aspirate. So, it is taking you to part text C. Aspirate is taking you to text C. So, after text C, then you have to go to next part. So aspirate more than 5.5. Now you will go into the first slide or the second slide. Okay. So now aspirate is not working. Okay. Aspirate is pH 5 is 5.5. Okay. Aspirate got and exceeds pH level 5.5. Now there is more problem. Aspirating. Okay, aspirate obtained. Aspirate is obtained. pH is more than 5.5. So you get in the first half or second half, that you have to see. Okay. So this is the first part. Or second part, yours. Now it goes to aspirate. The word aspirate is taking you to, okay, 14th question. The question as the word aspirate is taking you to here. Now, second question is, now, where it is taking? Where is it taking exactly? Okay, where it is, where is it taking exactly? Okay, so fine. Now you see, exceeds, aspirates is okay, but if it exceeds 5.5, aspirating okay, but pH should be 5.5, moderate, less than is okay, but if it exceeds, then there's a problem. If it exceeds, then there's a problem. So aspirate level is done. So that is, now you say it is going to first part, first half or second half. If it is first half, write 1. If it is second half, write 2. Okay. First half means write 1. Second half means write 2. Aspirate is done. And there is no use of aspirate now because aspirate has come, but it is not fine. It is exceeding the limit pH 5.5. So now you have to take somewhere where you have to take. That's the point. That is not working. Because the next one is coming, pH is coming now. Okay. Okay. Aspirate is there. Aspirate is there, but exceeding. So aspirate is there. And this next stage is aspirate exceeding or not exceeding. Less than 5.5 or more than 5.5. Again, 2 types. Okay. So this is taking you to the next level. This is taking you to the next level. So you have said which part? Now, let me see. Yes, first part. You said first part. Okay, right. Actually, it is after that one. So two types aspiration done. So it is second part. Aspiration finished with aspiration now. Okay. So that is the second keyword. Sorry. So second word has come, exceeds. Now here, now what is the word which will take you exactly to the answer? What? 1 minute. Okay. Yeah. So here it is. If aspirate exceeds pH 5.5, so more than 5.5, more than 5.5, where should you take the patient to confirm the position of the tube? Okay. So there's a point. So number is very easy. So 5.5. More than, it will show the arrow. More than, it will show you the arrow. Now let us take to, second slide. So this is, see here, where is 5.5? Okay, first aspirate, second aspirate. After second aspirate, then no or yes. So there you see here. Okay, clear, all right. That's it. You can see there now. So now you can see here. Okay. Here is first slide C, and here is second slide C, where numbers are there. So PH, capital letters. Okay, PH, H capital letter. 1.1 to 5.5 and 1 and 5.5. See, 1 and 5.5. Between 1 and 5.5, pH not between 1 and 5.5. So exceeds, where it will go. Now we can see here. First part, so here in the upper part or middle part or lower part. Upper part or middle part or lower part. Where is that? 5.5. Just see that one. Where is 5.5? Up or middle or bottom? Top or middle or bottom? Top or middle or bottom? So now, so where should you take him? Now the question is, where you should take him? Okay. Now I'll take you to the question once again. Okay. If aspirates exceeds pH, if aspirate exceeds pH 5.5, where should you take the patient? Where means location. Write down, where means location. Where should you take? Where means location. Write down. Where means location, place. Okay. I'll give you some words for this one. Okay. Okay. Question words. Question words. Okay. Question words. What means think? What means when. When means time. Where means place or location. Okay, what, when, where. Why? Why means reason. Thing. What means thing or object? When means time. Where means location. Why means reason. How means manner or method. Then who means okay. Who means person. Okay, who means person. Okay, but acting person. What, when, where, why, how, who. The next one is whose. Whose means okay, action receiving person or receiving person. Okay, what, when, where. What, when, where, why, how, who, whose. What, when, where. What, when, where. Okay. Okay, what, when, right. Question words are here. So these are the question words. What, when, where, why, how, who, whose. So what is asking you about thing? When is asking you about time? Where is asking you about okay. Fine. So these are the points which you have to write. Make a note of these things. Keep them in your mind. Okay. So what the question is asking. Okay. Every question asks for different things. Don't think that they say ask the same one and the same thing. Okay. Right. So got it there. Here, right. So that is it. If aspirate exceeds pH 5.5, pH means hydrogen ion concentration. pH, I studied when 84. I don't remember exactly. pH concentration. Okay. What is pH? Okay, fine. This is it. If aspirate exceeds pH 5.5, where should you take the patient to confirm the position of the tube? Where did it go like? Okay. So that's it. Yeah, now you write the answer. Answer, you have to move to the right side or the left side. Okay. pH between 1 and 5.5 means what? pH not between 1 and 5.5. Same word is not given. Exceeds is not given. Exceeds is not given. Okay. But you have to understand from that. Read between the lines. Exceeds 5.5 means, is it between 1 and 5.5 or is it not between 1 and 5.5? Exceeds 5.5. See carefully. So now you have to move down or towards right side. So take him to where? Take him to where? Now write your answer. 5, 4, 3, 2, 1. So here, what is there? What is there? Answer. Yes. Type your answer. Okay, Linio came back. Bohloko came back. So fine. So there you have to search. Okay, now you type the answer. Where exactly? So what is the question is asking? If aspirate exceeds pH 5.5, where should you take? Where should you take the patient to confirm the position of the tube? Okay. Okay. Yeah, 2 people have written. What is that? Elizabeth, 2 X-ray and cinemol. Cinemol, you have written wrong. Correct it, please. See in the question paper and write what it is written. Something is missing there. Answer is correct, but it is not 100% correct. It is only 99% correct or 90% correct. Something is missing. Type again. Okay, fine. Yeah, that's right. Absolutely right. But actually, in the question paper also it is wrong. It should be capital X. Okay. By mistake, type it. This is called devil's mistake. Typist's mistakes. Okay. Typist's mistakes. Okay, fine. Next one. Very good. Okay. So, to X-ray. Proceed to X-ray. Ensure reason for X-ray documented on request form. Okay. To X-ray. Yeah. To X-ray. That's good. To X-ray. Fine. Yes, very good. You are going step by step by step. How to identify? Finding the answer I could have given in just 10 minutes. I would have put the question answer sheet there. Okay, that is not important. Okay, because one student, at least if they get more than 450, that makes my day. Okay. One student, I am least bothered about 100 students. One student, if they give, I'm only trying for that, 470 or 480, that makes my day. That is A grade. I'm trying for that. Okay. This special workshop is for those people. Otherwise, day classes normal for everyone. According to your timings, this is my free time. I am leisure. Nobody, I did not give anybody this time. But still I am teaching, means not for you, for me only. Okay. So don't think that Simon sir is teaching odd times. I'm not teaching odd times. This is okay. Print screen. Fine. Right. This is question number 14. Sorry. Right. And one more good. Okay. That's not problem. 14 here. So change. Okay, no problem. Question number 15. Yeah. What device allows for the delivery? Device means equipment. Device means equipment or machinery or whatever it is. What device allows for the delivery of feeds via the small bowel? Delivery of feeds via the small bowel. Okay. What device allows for the delivery of feeds via the small bowel? Sorry. This is question number 15. Last question of the second set. From tomorrow onwards, you will do very fast now, I know. Okay. What device allows for the delivery of feeds via the small bowel? Now you have to tell me which is the word which will take you, to the text A, text B, text C, or text D. What is the word you think? Come on. Type 5, 4, 3, 2, 1 and submit. Yes, very good. Lineo Loco, very fast. Very fast. Are you the first one who has written this one? Oh. Yes. No. Elizabeth. Then linear. Right, very good. Feeds. That is the clue. That is the feedback you're getting from the text. Feeds will take you to D or B or A or C or A or B or C or D. Now type in your answer chat box. 5, 4, 3, 2, 1 and submit. Submit. What about the rest? Okay. Everyone is tired, I know. Okay, more tired than me. R. Where did R come from, Elizabeth? Okay, okay. Instead of down arrow, you have typed up arrow. No problem. I was thinking, where is this R coming from? Good. Sometimes we have to enjoy, otherwise we'll be very serious and our heads get blasted. No problem. I think there is a smile on your face. Very good. Okay, that's it. So this is giving that it is D. Feeds is the keyword. Now, what a device allows for the delivery of feeds via the small bowel. So, small bowel. Small bowel. So, there you have to go. And there, you have to see the name of the device. Name of some device. Only one device will be there. Name of the device. Just you have to identify and you have to find out and you have to answer. That's all. So device, name of a particular equipment will be there. Like how syringe was there here. Here, another device will be there. Near small. Go to feeding. There go find small bowel and find the device right there. That's all. Okay. Now, I'm taking you there. Yes, this is C2, this is D. Okay. There you are. Check. 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 Small bowel. Where it is? Small bowel. Where it is? Top or middle or bottom? Top or middle or bottom? Type. Top or middle or bottom? Okay. Smita top, Elizabeth top. Okay. Now tell me, first point or second point or third point? Number. Okay, number you can write 1 or 2 or 3. No need to write 3HIRD. Just put a number. No? That is called technique, saving time. Why you are writing THIRD? You are spending 5 seconds. Just to use 1 second, that is speed. Immediately you have to think whether you have to write 5 letters or only 1 number. That is fine, Elizabeth. Where is type again, Elizabeth? Type there, number. I'm making you follow it. Okay? That's fine. I'm very happy now. You're finding out. See, it's called waste of time. So you have to save your time. That is, see, if you cannot save your time for 5 letters, you are writing for instead of 1 number. So that is, so you should know which is important. Number is important or word is important. You have to decide fast. Okay. Now, okay, you got the answer. Now I want you to type the answer. Come on, fast. It is a phrase. It's a 3-letter phrase. 3-letter phrase. 3 letters. Okay. Bohloko, type again. It's incomplete answer. Pump is a noun, so there should be definitely an article. Yes, very good, very good. Excellent. Okay. First attempt only you have to clear. With me. Okay. What about the others? Okay, finished. Now, so hide floating meeting controls. Okay. Print screen. Okay. 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 So that's it. Okay. I'm making you learn patiently so that never in your life you'll forget these techniques. Even in your sleep, you ask a question, you will reason all these points, even in your dream. Like that, I'm making you. Yeah. Next. So, right. So, second part questions are over. The second part questions are over. Now you are going even faster now. Okay. These are the last 5 questions. 1, 2, 3, 4, 5. Okay. 1, 2, 3, 4, 5. Right. Okay. Yes, Simon sir is tired. Fine. I have finished all the questions. Okay, third part is left. So tomorrow we'll see the third part. Okay. Now, okay. So just one. Okay. Feedback. Feedback. Please. So now, what did you learn? How was it? Was it beneficial for you? Did you like the session? Okay. Feedback. Aisha, Dr. Aisha, your exam is over, but still you are preparing. Oh my God. That means how much you like the subject, I don't understand. One day before the exam also, I gave you 3-hour lecture, you attended. Now this is 5-hour lecture. I don't know how much time it took. I don't exactly remember. So just let me see in the YouTube when it started. Then I can tell you. I don't even remember when I started. Okay, fine. Write your feedback, please. Very good, awesome. I learned that we should be careful when writing answers. Wonderful and very interactive session. Thank you so much, sir. Learned so many things today. Also, when reading questions, very good. Thank you for your efforts, sir. The techniques that you are using is very easy to follow. But people don't have time. What to do, Elizabeth? People don't have time. They don't want even to attend. They want to work, they want to make money, they wanted to cook, they wanted to do everything, they want to enjoy. Okay, fine. I'm giving chance for unmuting. Yes. Okay, first let us start with last one first. That is Cinemol, last one. Just now she has typed. The class was really good. Most of the time we have difficulty in finding appropriate answer. Really, I understood. Okay, yeah, Cinemol.
Yes, sir. Yes, sir. Hello.
Yes, please carry on. It is your time.
Sir, as I typed, it has the difficulty to find the appropriate answer because sometimes I won't add the article in the answer, but now I understood what the importance of articles and all. Really wonderful class, sir, and I could understand how to find the answer also. Help of the words and all.
Don't you think that I spoiled your sleep? I disturbed your time and I wasted a lot of your energy or something like that?
No, sir, never, sir, because I liked your lessons very much because I am waiting for a lessons only. I know you are also a busy person, and whenever your lessons are there, I will attend all the time because I like your lessons very much.
What is the difference? Why you like Simon Sir's lessons? There are many people who are teaching. What is the difference?
And actually, sir, in the reading and listening, I followed the different approach. And I couldn't attend, couldn't earn my required score through that strategies. But this time, while I'm practicing, I used the strategies. I could earn more than the marks that I expected. That is the different thing that I learned from you, and I applied on my daily task, whatever I have done. But it has a lot of difference from the strategies that I learned in the past and that I learned in the today. It was really awesome.
Okay, thank you very much. Next, next is Elizabeth. Yes, Elizabeth, it is your time now. Hello, Elizabeth. Are you able to talk? Okay. Lineo. Yeah, Lineo.
Yes, hello.
Hello, dear. How are you?
I'm good.
Yeah. Share your experience, please.
It was my first time, and I didn't even attend in time. I was late, but I learned a lot where I was with you, especially where you talked about the scanning. I didn't know what to scan. I only had people talking about scanning and skimming, but I didn't even know what to scan. But you made it easy for me to understand what exactly am I looking for. So I saw that it is more easier to find answers. So I promise I will attend every day. Thank you so much.
Yes, yes. You were recommended by somebody. What's that? Ernest Entehne, right?
Yes,
He gave my number to you, right?
yes.
That time you did not know. Now, what do you feel the difference? That time he just gave you number and you did not know anything. And you actually, Entehana requested me to admit you. So he told, sir, I will do that. Something she requires some support, I will do. And he told, so you did not message me. So I could not know whether you wanted to join or not. So that's why I sent you personally. So you have to be thankful to Ernest.
Okay,
You have to
I'll
say
thank
thanks
him
to
too.
Ernest. Yeah, otherwise I would not have even known that you wanted to join these sessions now. Okay, fine. Next, Smita Kanta.
Yes, sir. Hello, sir.
Hello, dear.
How are you, sir?
Oh, I'm exhausted.
Yes, sir. I know that it's already so late in India.
It's what time it is now?
I think 3.
Yeah, of course. Yeah, it is. I don't even remember. Yeah, 3:22, 3:30 almost. Yeah.
Yes, sir. Sir, I have attended so many sessions of yours. Was first time I have attended this kind of lecture. Like I have attended already previous part A, but it's totally different from that lecture. So I have learned so many things: how to look at the answer, how to look at the answer from the keywords, and how to write the answer properly.
Okay, very good.
Really a good session, sir. Thank you so much.
Very good, very good. Try doing like this. Okay, don't just to go and finish 1 hour test like that one. Okay.
Yes, sir. Yes, sir.
This
I'll
is
try to apply that.
test. You do in 2 hours also, no problem. No?
Yes, sir.
When
Yes, sir.
practicing, you learn what is this, learn the steps. Then afterwards, speed will come.
Yes, sir.
Okay. Thank you. And
Thank you
then
so much,
next,
sir.
oh, very good. Welcome. It's my pleasure. So next one is Elizabeth. What is this? Sinimola. Is that somebody? Hello, sir. Elizabeth. Yeah, Elizabeth. Can you speak? Smita Elizabeth. Elizabeth. Okay, you're not able to speak. Okay, at least you type if you want to type anything. Otherwise, that's the end of the time. Okay, Dr. Aisha. Aisha Murtada, do you have anything to type or write? Because I don't know. Your mic is not there, so that's why. So 30 seconds. 30 seconds. 30 seconds, and I'm going to close. If you want to type anything, you can type. Otherwise, good night. Have a nice day. Okay, no problem. Don't worry. Yes, good night. Have a nice day.